Shall we start, sir?
Yeah, no problem.
Okay. So, a very warm welcome once again to all the participants on this platform of Up Dental Academy. And we are here to learn a very important topic for all of us, that is mobile dental photography, by our very dear mentor, Dr. Akash Akinwar. So, sir doesn't want everyone to put more time into introductions. I have shared the CV, just a small intro of Dr. Akash Akinwar. He is a periodontist and implantologist, completed his degree from a very renowned GDC Mumbai 22 years back. And since then, he has performed more than 9,000 surgical procedures, and he has trained more than 2,000 doctors worldwide. So he is a global mentor for ADN India and uh, mobile dental photography. He has done many courses till today. His academics, and he has also co-authored the clinical fixed prosthodontics and published more than 51 scientific papers. He has got awards like Best IDA Member, FAMDEN's Implantologist of the Year, and beyond clinics. He is a licensed PADI scuba diver, snake rescuer, and internationally published wildlife photographer. It was difficult for me to cut down the intro, sir. Sorry if there was any improper things that I said. But yeah, you all can read the intro that I've shared of Dr. Akash Akinwar in the group, and you all will be overwhelmed with the achievements that he has. Over to you, Doctor.
Thank you very much, Deepa. Thanks to Up Dental Academy. And without further ado, let me welcome each and every member who is present here right now, and all those who are going to see this presentation afterwards through our recording for next 15 days. So, as you all are here with me, I want you to pay complete attention, because this is going to be a wonderful virtual ride of dentistry. As you all know, especially in last 5 to 10 years, dentistry has evolved a lot in terms of digital instruments, digitization of overall workflow, and that is why photography or documentation has somewhere taken a center stage in dentistry. We all want to document our cases so that one patient can take those photos and share it with 100 more people, and that is how you will get many more patients to your clinic. So in this overall presentation of MDP, mobile dental photography, we are going to see what magic documentation can do in your practice and how you can grow your practice, because at the end of the day, whether you learn implant, veneers, crown and bridges, endo work or ortho, ultimate aim is to grow the practice. Success can be different for everyone, but growth is something which is very constant in terms of calibration. So everybody should grow in terms of earning, in terms of having more patients every year, and in terms of having more advanced practice every year. So let's try to dive into the world of documentation. Before I begin main presentation, let me take you through some cases. I have more than 900 fully documented cases of implant only. Forget about other things. So we are documenting religiously. I will tell you everything. We are going to discuss everything, the tips, tricks, techniques. In these cases, I want you to check for documentation protocol, quality of my images, so that you will understand what magic your mobile can do. Editing, I have done in most of the cases. We are going to discuss editing also. Use of light, which is most crucial in photography, and how I have used different accessories. So this is the first case. You should always make a collage of introduction page whenever you are presenting something. So this was a pre-op situation. I will just run through it. This is reverse view. This is after prep, astringent retraction paste. And that time we were not having scanner. Now we have scanner. Since last 6 7 years, everything is digital now. And this is how we select the shade. I will talk about shade selection also. These were the Graphene Nano crowns. And this is after luting these crowns. You can see beautiful tissue integration. And I want to show you the most important picture, that is patient's post-op photograph. We will discuss about this because now dentistry is at the level where we have to show everyone what will be the impact of smile designing, what will be the impact of restorative treatment, what will be the impact of orthodontic treatment on patient's face. And that is why you need to record pre-operative and post-operative photographs. In this case, I didn't record patient's pre-op. That was my grave mistake. But you should always take pre-op photograph as well. You can always make a small collage just to explain anyone. It is very easy for patients to, make out what treatment you have done and what is the effect of treatment in patient's mouth or on patient's face. This is how. Case 2. Another case, pre-op image, you can see patient was having spaces. She was in a hurry. She was in a modeling industry. She was not interested in putting braces. She wanted a quick fix. So we decided to go for veneers. And we also use a software. I will show you this software for virtual mock-up and to convince the patient. And this is how I select U value chroma. We will discuss it later. Don't worry. Right now, just let me take you through the cases. And this is how we did shade matching without flash, with flash, and using a polarized filter. I don't know how many of you are selecting shade using proper light. We'll discuss about it later. Preparation of veneers, impression again, because we were not having scanners. Now we cannot imagine our practice without scanners. And these are all photographs taken from the lab, and beautiful veneers were made, and those veneers were luted in patient's mouth. I will show you immediately after luting. Maybe if you wait for 7 or 8 days, you will find a beautiful tissue integration, but immediate post-op result was great. You can take the extraoral smile photographs also. Pre and post images are very, very powerful in convincing other patients. These are all cases of my wife, but I only document the cases in my clinic. And I have also trained my staff, which is again very important. This is pre and post. You can see the workflow. Okay. You should always give due credit to your labs. They deserve it. Case 3. Whenever we are doing surgical cases, we record them very meticulously. Incision, reflection, guttering, okay, elevation of tooth. You can see the post-op socket, tooth, and closure. So we have to record surgical cases very meticulously in a very clean manner. Case 4. This is implant case. As I said, I have more than 900 documented cases of implant, start to end, with follow-ups also. Most of them are with follow-ups. You can see how we are recording implant cases. And I want you all to see the beautiful tissue topography in this case, right? And then prosthetic phase, you can always show all the instruments, equipments, material, step-by-step documentation so that anybody can understand what you are trying to say through your photographs. So your case documentation should be like a storytelling. This is very important. Ek storytelling hona chahiye, so it will be very easy to grasp through your cases. And this is complete workflow of this case. Huge photo, lot of photographs in this case. You can make out. Flapless case. Very commonly we are doing flapless implant placement in our practice. Look at the documentation. Very simple way of using radiographs, clinical pictures, and this is physical impression. These are all old cases. I don't have recent cases where we have physical impression. We are only taking digital impression now for single multiple. Look at this case of socket shield. Mesodistal sectioning, elevation of palatal, and reshaping of shield. You can see how beautifully shield is shaped, and implant placement in the socket. Provisional was given to the patient. Definitely this patient needs smile designing. Deep bite, yeah. So that was about just these 5-6 cases. This was just you can say warm up for you all. Now let's begin with the main presentation, that is mobile dental photography. Once again, I welcome you all. I want your 100% attention. And as I have already mentioned, if you have doubts related to any slide, please put your doubt in WhatsApp group. Deepa and we have another moderator, Muskan. They will read it out for me or they will point it out and I will attend the questions. So don't worry, you are free to ask questions. So our today's agenda for this 8 to 11 p.m. session is DDLJ. I guess most of you are aware about DDLJ. It was a famous Bollywood movie, Dilwale Dulhaniya Le Jayenge. But I am not talking about that DDLJ. My DDLJ is different. Obviously, first D is dentistry, second is documentation, third is we are going to speak something about life also. And yes, let's have a lot of fun in this presentation. I will try to give you a lot of messages to balance work and life. Try to avoid taking photographs and all. Don't waste your time. This presentation is available for next 15 days. You can always go through it. Just pay attention. Try to clear your concepts. So our today's agenda is introduction to mobile dental photography, scope and benefits of mobile dental photography, tips, tricks, and techniques of MDP, which is the heart of this session. So today we all are here to bring a big change in our practice because the only thing that is constant in human life is change. And we have witnessed a lot of changes, but change has also given a lot of best things to the mankind, whether that tring phone to that Nokia ka 3310 or 3100 to today's phones, which are even foldable. So we have done a great development in terms of technology, in terms of cameras in mobiles. And dentistry has also seen a lot of changes over the last few decades. Digital radiographs, microscopes, CT scan, advanced materials, scanner, implants, whatnot. I think we are enjoying the best era of dentistry. Another 5 10 years, they are going to be more interesting, I can say. Be ready for that. A lot of great things are going to happen in another 5 to 10 years. So we have accepted everything, but still a big no to documentation. A lot of people think that I need to learn veneers, root canal, ortho, implant, but they forget to learn documentation, which plays a crucial role of binding all these treatment factors or treatment modalities with your patient workflow, as well as it also helps to bind your patient or bound your patient with your practice. Because if you document, your patient understands that you are taking care of each and every detail. And though when you share those photographs with patient, first thing they will do is they will put those pre-post photos in their family groups. And that is how a lot of discussion will happen on you and you will get free of cost references. Trust me, a good message that I want to tell everyone is today is the era of showing patients what you can do. If you fail to show them through pictures, through photographs, through videos, they will not get convinced to get the treatment done at your clinic. So today is the era of showing things to patients, and that is why you need to document your cases. Why people don't document? Because if it's important to you, you will find a way. If not, you will find an excuse. So a lot of clinicians have not yet understood the importance of documentation. And that is why they are just focusing on other things. I believe all the magic happens out of comfort zone. हम लोग बहुत comfortable है हमारे zone में, especially those clinicians who are not documenting. You are very happy with your clinic timings. सुबह शाम जाओ या morning to evening जाओ, patient करो, and no need to document anything because you are in your comfort zone. But friends, the magic happens out of comfort zone. जब तक आप आपके कंफर्ट जोन से जंप नहीं करते हो, बाहर नहीं जाते हो, you cannot explore the world outside. You cannot explore or find the magic outside. So I very strongly believe in life about this. जब तक कुछ पाना है, कुछ करना है, तो you need to jump out of your comfort zone. And this is a beautiful chart for everyone, how anybody can grow from donkey to unicorn. Let's agree on this. Even I was in that stage of donkey. I tried to come over my fears, fears of lack of confidence, find excuses, be affected by others opinion, and वो होता है fear zone. हमारे आजू बाजू में हमेशा fear zone होता है. उस fear zone को आप cross करते हो तो you get into learning zone. And I must congratulate everyone that today you have enrolled. It means you have zeal to learn new things. It means you all are already in learning zone. That's the best part. So learning zone अगर अच्छे से successfully करते हो, तो after learning zone, next zone is growth zone. And as I told, success is secondary, success is subjective. What is important is each one of you must grow. आप एक साल पहले क्या थे, आज आप क्या काम कर रहे हो. आपका वर्क लेवल, आपका स्किल लेवल, आपका एक्सपीरियंस लेवल, आपका प्रैक्टिस लेवल, पेशेंट फ्लो, everything should grow along with time. So, why clinicians avoid documentation? What are the reasons? क्या reason है? Clinicians document क्यों नहीं करते हैं? So I did one survey and I find out that the first reason is they think that documentation is time consuming, which is absolutely wrong. Along with your cases, you can document every day. I take so many photos and videos every day. I'm posting it in my core groups of implantology. I'm posting it on FB. Trust me, I have a very strong presence on YouTube. I get a lot of patients from there. They see my cases. More than photos, videos are impactful. But if you document properly, you can convert your photographs into video. There are hundreds of software available. I don't know how to document. A lot of people think documentation is very complicated. It's not my cup of tea. Third, I don't have DSLR and lens. So now the problem is solved. You really don't need DSLR. I have DSLR, but I never use it in clinic. I use it only in forest. I use only mobile camera. Point number 4, I don't know anything about photography. Absolutely true. To document a work, you need to have little bit idea of photography. That is why we are here. I will be giving you good points, simplified points to record or take good photographs through your camera. I am not a mentor or speaker. A lot of people think that only mentors, speakers, and teachers or people associated with college research need to document. That's absolutely wrong. Every clinician must document. You should see the clinicians of Europe, clinicians in American zone or other areas. They all are documenting their cases because they have realized far earlier the impact of documentation on practice on patient's mindset and how it gives you more referral cases. Point number 6 is the most important. Many clinicians have not yet realized the benefit of documentation. So now the question is how to begin documentation, how to use mobile camera for documentation. You must be in a confusion state, but wait for a few hours and at the end of this session, you will be very clear with every option. You will understand how to start documentation and how to use mobile camera. I will request everyone to keep some paper or pen ready because I will be sharing a lot of important points, but you have this presentation for 15 days. So no worries, you can always note it down. I believe there are 3 important pillars of documentation. ये lifetime के लिए ध्यान में रखो. First pillar है, you have to take a perfect image. You cannot just take any dark image or blurred image. It is of no use. Image must be crisp, clear. So perfect image is important. Second point is when you take image, you need to edit it. थोड़ा बहुत editing सीखना चाहिए. And I will tell you now openly to everyone that Indian clinicians are very poor with technology. I am not saying everyone, but most of them are poor. They never learn computer. They never learn technology. They don't know how to handle mobile. Most of them don't know how to edit photos. There are beautiful editing softwares, free of cost videos, demonstrations on YouTube, but they never learn. So editing is the makeup tool of image. आप सिर्फ फोटो लेके कहीं भी डाल दोगे, it will look shabby. Even if I take photo, it will look bad. I need to edit my image. Editing is the makeup tool of photographs. Please remember this. And the third most important pillar, without good work, documentation cannot become good. आप गंदा, ugly, shabby work अगर करोगे mouth में, and if you document it properly, still it will look bad. So don't worry, if you are documenting your cases, documentation has power to make your work more beautiful over a period of time. Because every time you are doing work in patient's mouth, you will think कि अच्छा photo आना चाहिए, ये मेरा work अच्छा दिखना चाहिए. I have done suturing, it should look good. I have done veneer placement, it should look good. So you will crave for good work. You will crave to acquire better skills. You will crave for achieving good experience. And that is how, if you document, documentation automatically improves your work quality. I think that has happened with most of the mentors or most of the clinicians who are good at work because they document. So always remember, even if you are a beginner and your work is not good, do not worry. Start documenting. Your photographs will tell you everything about your work. And over a period of time, because of documentation, your work quality will improve. Look at this image. After implant placement, I cannot post image like this. I need to edit it little bit. Okay. Look at this case. We have given two crowns in this case. Zirconia, IMAX monolith crowns. Patient was a Bruxer. And this is how I presented. Central incisors are crowned in this case. Look at the beautiful translucency and shade selection and the integration with the tissue. Look at this case. This is how I want to present. So how you take photograph is not important. How you present it is important. Or other way, I always say, what you see in mouth is not important. How you want to show it to your clients, to your patients, to your students, to your doctor friends, that is important. Look at this image. So what you record is secondary, what you shoot is secondary. How you show it is important. That is why a perfect image, editing, and good work is very crucial. Now, when it comes to DSLR, let it be any DSLR or mirrorless camera, I am talking about this kind of mobile, smartphones. I am not talking about that old button wala mobile. Today's mobiles are fully loaded. Although we all know that SLR is dedicated for photography, mobile is a multi-purpose equipment. DSLR can be used for all situations, but you need to buy a different lens. Single DSLR cannot be used for all situations, but mobile doesn't have lens attachment. Now few mobiles are coming, and 5-6 years back only I told everyone that in future we are going to have mobiles where you can attach a lens. And see now, few companies have come out with lenses. Wait for another 4 or 5 years, the things are going to change. Yes, lens attachment option is there in DSLR. Mobile doesn't have, but now it has started. Another 4 or 5 years. The sensor in camera is large, so it gets more details. It gives you more detailing. But the sensor in mobile is small. But now again, mobile companies are coming out with large sensor. So I think another few years we will have amazingly powerful mobile cameras. And yes, the optical, because the sensor size is large, lenses option is there. DSLR gives you images with high optical quality. But even today's mobile cameras have a great sensor and they take a lot of light, a lot of details. So they give you images with good optical quality. But I personally feel more than mobile or SLR, the person who is holding the equipment is more important. We always say this in photography. More than equipment, what matters is person who is holding it. So your skills are definitely the most important when it comes to documentation. Look at this setup. If I want to do DSLR documentation, I need a camera, micro lens, additional lights. I need different light setups. But when it comes to mobile photography, I just need a good mobile. I am going to tell you which mobiles are good. Okay. And sometimes I use these additional lights in my clinic. I will show you, suggest you few lights also. Don't worry. Now you might have seen this kind of artistic photographs taken using DSLR. I have also taken these photographs with DSLR. These are all my photographs taken with DSLR. But even mobile camera can be used. So when you use DSLR, you need all these kind of things. But as I told you, I am not doing DSLR photography in my clinic. This is just for the sake of demo. What I do is I use only mobile camera, and even mobile can be used for a lot of artistic photos. You can do a lot of creative photography in veneer cases, smile designing cases, composite cases, implant cases. There are a lot of ways, different ways to take photographs. Okay. So all these are photos taken with mobile. You can see the detailing in the picture. So now the question is, why documentation is important in clinic? Why every practitioner should document? Number one, the biggest advantage of documentation is not to show it to everyone, but to learn from your own work. You can analyze your work, where you have done what, whether the work is done right way or wrong way, it is looking good or bad. Without taking photograph, you will never come to know. If you do a composite, anyways, when you put any white cement on the tooth, it looks good. But whether that work is done properly or not, you need to take a photograph. And self-learning is the biggest advantage. I have learned enormously through my documentation about implant dentistry. My photographs, my cases, my documentation has taught me a lot, more than any book. And that is why learning is the main goal for all of us. Virtual record. I have a beautiful virtual record of all my cases, which is very important in many ways. Patient education. We all know that until and unless you show your work to your patient, they are not going to get convinced. And I personally feel, to convince any patient, you should have a library of your own cases. Whenever patient come to my clinic, I just open my cases and show them, and they are almost convinced after looking at the cases. So patient education is a big advantage. Most important now, as labs have evolved a lot. Lab work is very important. Without lab, we cannot grow. So to communicate with lab, photography or documentation is the best way. I will tell you about that. Academic. For academic, scientific research and publication work, we need to document. So lot of people think कि हम लोग क्यों photographs को publish करें, क्या जरूरत है, हम लोग clinicians हैं. So when I was associated with GDC, when I was a lecturer, assistant professor, I used to have only 10 to 11 publications. Today I have 51 publications. Means I have published almost 40 cases after becoming a full-time clinician. So it's a different level of achievement, sense of achievement, and you should publish your good cases. And obviously now marketing means everybody is going on social platforms, especially on Instagram, and to motivate any patient, any layman who is looking at your account, your cases, you need to have a quality photographs and videos. And that is why the documentation is very important nowadays. You need to have your own cases to convince patients. So that is why I believe these 6 reasons are important for documentation. But at the same time, I have seen a lot of good cases being spoiled by wrong documentation. Just because clinicians were not aware about documentation, they have ruined their cases royally. So I will show you a few examples of good work and wrong documentation. Look at this case. The pre and post is result is amazing, but the documentation is absolutely bad. This could have been done in a much better way, right? Look at this case of gingival fibromatosis. Someone has recorded this, but this recording is not great. Okay, look at the surgical workflow. The result is outstanding. If you see the pre-operative and post-op cases photograph, the result is outstanding, but the overall documentation is not great. So in our clinic, we always take pre and post photos. Even if you take a pre-op facial photograph, post-op facial, pre-op intraoral, post-op intraoral, it can make a big difference in patient's life. Trust me. So this kind of pre and post absolutely not recommended. I always believe you should take good pre and post. Now in this photograph, you can see, I told my lab that this crown is looking absolutely ugly. You have not done a good job. Look at the incisor translucency. So I told him, you just do one thing. I'm sending you photograph. You just copy the adjacent incisor. And then he sent me another crown that was quite good, not bad. Same way, we always take pre and post photos. And I always see whenever people take pre and post, they do not follow the plane. Look at all my cases, pre and post. We always follow the plane. Plane is very important. Your photos should look exactly same except the treatment that you have done. Same way, you have to take good pre and post photographs of the face. How to take these photos, I will discuss with you. But these are most powerful. Look at this case. She is a music teacher in Parley School, and her pre-operative smile was like that. And after treatment, after FMR, her face has changed totally. You can see and you can make out. So imagine, friends, this is the impact of dental treatment on someone's face, someone's life, someone's confidence. And that is why I request you all to start documenting what are the advantages of mobile photography. We all know mobile is very easily available, easy to use, and very handy instrument. It's very portable to use while doing procedures. It's a lightweight, and that is why very quick to use. Chairside assistant can use it under your guidance. Even if your assistants are not very much learned or advanced in technology, it's fine. They can learn and master photography in no time. Unlike DSLR, mobile is easy to learn. Mobile photography is not difficult. Anybody can master it. There is no separate investments like DSLR lenses. You all have mobile camera with you. Easy to click, store, and reproduce images. With mobile, it's very easy for me to take photographs, transfer it immediately to my computer, and store it properly. Easy to master within a very short span of time. Yes, the mobile photography is very easy to master. And even if you are using DSLR, these points will help you out. The points that I am going to share soon. What are the requirements to document a case with mobile camera? So now you want to take photographs with mobile camera. The first requirement itself is a good mobile. You need a good mobile with at least 8 megapixel camera. Nowadays, every mobile has more than 8 megapixels, so you don't have to worry. Retractors are very important. We'll discuss about retractors. You should have few background cloths. I will discuss about it. Photography mirrors are very crucial in dentistry. Nowadays, there are metallic round mirrors with handle. And these are large size mirrors, 3 centimeter, 5 centimeter. They are amazing. We'll discuss that. Background paper or acrylic contraster if you want to take photographs of maxillary and mandibular arches for with a black background, you can use it. You need a well-trained dental assistant or chairside assistant. If you have associate doctor, you can train them. You have assistants, train them. Basic idea of photography is important. So now you all must be thinking which mobile is good for photography. So let me tell you, first of all, Samsung is supposed to be good. Few models of Google Pixel are good. Few models of OnePlus are also good. iPhone overall I find is a bad for dental photography. iPhone users, I am very sorry, but iPhone may not give you great photos. Few models of MI were also good. And all these blue colored companies, they boast that they have a great camera, optics, and pixels, but trust me, they don't give you good result. So, how to decide? I want everyone to first note it down. There is a mobile called Note 10 Plus. It's a very old mobile. It's now completely not in sale. Okay, discontinued by company. But if you find this mobile anywhere, repaired model, or even if it is packed, buy it blindly. 10-12 हजार 15,000 में आ जाएगा. Earlier it was 60-70,000 80,000 rupees costly, but now it is discontinued. So refurbished or repair किया हुआ मॉडल मिलता है. Samsung Note 10 Plus. Buy it blindly. This mobile is mind blowing. I have two mobiles. Samsung Note 10 Plus only for MDP. मुझे और एक पीस मिलता है. I will buy that also. Till date, that is the best mobile for MDP. Even better than today's mobile cameras, S24, 25, 26. It is too good. Okay. So now how to select a mobile camera? Now you may select mobile camera of any company, and whatever you like or whatever you have. But how will you come to know that ये camera अच्छा है photography के लिए? So look at these three photos. First is when you use a flash of the mobile, that flash should give you great details intraorally. ये पहला criteria होगा आपका. Second, you can look at the color tone. Color tone looks so natural. Whatever I see in patient's mouth, I see exactly same colors in my photographs. Otherwise, few mobiles will give you reddish, bluish, yellowish colors, magenta color, and that spoils the overall color tone of the image. Third is a depth of field. Depth of field means whenever we do dental documentation, we always want every teeth clearly visible in the photograph. Or like this image on the right side, all the implants are visible. This image on left side, all the teeth and even the scan bodies are visible. So depth of field means जब आपका कैमरा सारी चीजों को कैप्चर करता है क्लैरिटी से, you can call it depth of field. I will cover it later, don't worry. Now, I personally feel best mobile camera is yet to come. There are a lot of cameras in the market, but still lot of research is yet to happen and great cameras will be there in the market after a few years. But even today, mobile camera is very useful to take portrait, landscape, food, travel, architectural, night photography, macro or wide angle shots. And at the same time, mobile cameras are really good in dental photography. Only thing is, I have given you the selection criteria. क्या अच्छा होना चाहिए? Flash should be good. Number one criteria, because we cannot take intraoral images without flash. So good flash, color tone should be rendered perfectly by camera, and third is depth of field. Now, what is pixel? I don't know how many of you are aware about pixel. I will tell you in simple words. Pixel means physical point or smallest element in an image. Look at this image of bald eagle, American bald eagle. इस image को अगर हम crop करते हैं and zoom करते जाओगे, तो at the end you will find one square. तो आपकी image में जो एक one square होता है, that one square is 1 pixel. So what is the meaning of 1 megapixel? 1 mega simply means 1 million pixel. Means 1 mega means 10 lakh pixels. 1 million is 10 lakh. So when I say my camera is 10 megapixel camera, means the image produced by that camera will have 10 million pixel, means 1 crore. तो जब आपका कैमरा 10 मेगापिक्सल का है, उसमें 1 करोड़ पिक्सल होते हैं. जब आपका कैमरा 50 मेगापिक्सल का है, तो वो 5 करोड़ पिक्सल्स होते हैं. एंड पिक्सल का काम क्या है? टू गिव डिटेलिंग इन योर इमेज, टू होल्ड द डिटेल्स ऑफ योर इमेज. तो जितने ज्यादा पिक्सल आपकी इमेज में है, उतना आपका इमेज डिटेल दिखेगा, क्लियर दिखेगा, शार्प दिखेगा. यू कैन सी डिटेल्स, वो फटेगा नहीं, ब्लरिंग नहीं होगा उसमें. Okay, I hope you are clear with the pixel. Pixel is the smallest element in image. Now, how much megapixel camera is enough? So to be very frank, for wildlife photography, I am using 50 megapixel camera of Sony Alpha 1 Mark II, which has got 50 megapixel. मतलब जब मैं एक इमेज वाइल्ड लाइफ की लेता हूँ, उस इमेज में 5 करोड़ पिक्सल होते हैं. उसका फायदा वाइल्ड लाइफ फोटोग्राफर्स को होता है कि हम इमेज को अगर क्रॉप करते हैं तो भी डिटेल्स मेंटेन होती है. बट डेंटल फोटोग्राफी इज समथिंग वेयर वी डोंट नीड टू क्रॉप मच, क्योंकि आपका पेशेंट सामने बैठा है, आप मोबाइल से उसके क्लोज जा सकते हो, तो यू डोंट नीड टू क्रॉप योर इमेजेस मोर. तो क्रॉपिंग नहीं होगा तो आपके पिक्सल से होते हैं. दैट इज व्हाई 8 to 10 megapixel camera is more than enough for dental photography. But आप जब डेंटल फोटोग्राफी कर रहे हो, यू नीड टू अंडरस्टैंड एंड लर्न CCD, capture from correct distance, how to take photographs from a correct distance. Now look at this image. This is how most of the clinicians take photos. Now in this photo, the area of interest is this. बट आपकी ओवरऑल इमेज में सपोज आपका कैमरा 10 मेगापिक्सल का है, तो 10 मिलियन पिक्सल्स मींस 1 करोड़ पिक्सल. तो सारे पिक्सल स्कैटर्ड है, एंड उतने सारे इमेज में से आपने सिर्फ उसका 10% यूज किया. तो जब उस इमेज को आप व्यू करते हो, जूम करते हो, यू सी दैट इमेज लुक्स ब्लर्ड. इमेज में डिटेल्स मिसिंग है, बिकॉज आपने पूरी इमेज का इतना सारा पिक्सल जो था उसमें से थोड़ा सा ही पोर्शन यूज किया. तो आपने कम से कम पिक्सल लेके जूम किया है, सो यू आर नॉट गेटिंग मोर डिटेल्स. सो द राइट डिस्टेंस फॉर टेकिंग डेंटल इमेजेस is around 20 to 30 centimeter from the mouth. Please note it down. 20 to 30 सेंटीमीटर डिस्टेंस पे रखना है आपका कैमरा. And if you are taking third molar photos, then you can go very close to the mouth, maybe 2 centimeter, 3 centimeter away from the lips. But otherwise 20 to 30 सेंटीमीटर पे कैमरा रखो एंड आपका ओरिजिनल इमेज ऐसा होना चाहिए जैसा आप देख रहे हो. अब इस इमेज में से इमेजिन करो, मैं जब ये क्रॉप करता हूँ, आई हैव लॉट ऑफ पिक्सल्स हियर. मैंने मेरे पिक्सल सेव किए, तो यू कैन सी इवन पेरिकाइमेटा ऑन टूथ स्ट्रक्चर. पेरिकाइमेटा दिख रहा है, छोटी छोटी डिटेल्स दिख रही है. ऑल्दो दिस इज अ क्रॉप्ड इमेज एंड ये इमेज एकदम लो पिक्सल की है, मैंने इसको रिड्यूस किया हुआ है सॉफ्टवेयर में. So again, how to save the pixel and get details? Always take photograph in such a way that you need to crop it minimal. तो इससे क्या होगा, आप ज्यादा से ज्यादा क्रॉप नहीं करते हो, कम से कम क्रॉपिंग करते हो, तो यू आर सेविंग द पिक्सल्स. एंड दैट इज व्हाई पिक्सल जब सेव होते हैं, यू गेट मोर डिटेल्स. नाउ द मोस्ट इंपॉर्टेंट पार्ट ऑफ आवर सेशन इज tips, tricks and techniques. This is the heart and soul of mobile rental photography. Are there any questions, Deepa?
No, sir. Up till now, there aren't any questions.
Okay. So let's go ahead with tips, tricks, and techniques. I'm sure you will have doubts and questions in this section. So what are the points that I am going to discuss today? Light or flash, retraction, which is very important, framing or composition, focusing, depth of field, sharpness, plane of image, mirrors in dental photography, raw versus JPEG image, and editing. And the last important point that I will not discuss is creativity, because creativity is the core essential, one of the main recipe of the successful documentation, but that you have to bring it out from your mind, from your heart. So first point is light or flash. So look at these images which are taken in poor light condition. People have not used mobile flash. They have completely relied, trusted on natural light or clinic light. So पहला golden rule आप लोगों को लिख लेना है कि whenever you are taking intraoral photos, you must at any cost use camera flash. Okay, that's why camera flash is very, very important in documentation. So always shut down your chair light. Chair light on करके dental photography नहीं करनी है. The lights are, whether it's halogen or LED, they are very strong and focused. These lights have power to change the color rendition of your images. It can affect the colors in your images. So please shut down the light or turn it somewhere, okay, and then take photos. And as I said, flash is necessary, mandatory, must, compulsory. Look at this image without flash and same image with flash. You can see the details. Look at this image. It looks blurred. The colors look different. There is darkness and no detailing. And look at this image. So flash or light is so important. As I said, the problem with iPhone is most of the iPhone flashes are harsh. This is how you get images with iPhone. Most of the iPhone. I'm not saying every iPhone. If you think your iPhone is good, just put that iPhone for the test on those 3 points. The flash, color tone, and third is depth of field. So there are different lights that you can use. If you think that your mobile camera doesn't have good flash and I want to take good photos with my own camera, then you can use this light. But the cost is, you will be surprised, just 40,000. It's a MDP light, very good light, but I don't recommend this. I have another option, a Cocolux light, which I use every day. If you can see in the camera, this is the Cocolux light, which I use for two purpose, shade selection, primarily shade selection. And you can also use this light. It's a very subtle light for photography. You can mount on your mobile on this. You can see there is a mounting area. You can mount here your mobile and you can take photographs. And this Cocolux light comes with this beautiful filter. And this filter is a polarized filter. I'm sure many people are not aware about this filter. I will tell you the magic of this filter in shade selection. I am going to discuss shade selection also. So this light is now costing around 15,000 rupees and it is sold by Yogi Enterprises in India. I will share the number. Numbers are given here also. Tarpan Amin, and it's a Korean company. It's not Chinese product. It's a very good product. I have been using this light since more than 6 years, 5 years now. It's still working, you can say. So this is how Cocolux light is useful. And the most important use of Cocolux is shade selection. This light gives you excellent detailing. You can select shade. You can also take photographs with this light. So this is light. This is Cocolux light, and image was taken under this light, and you can see the other image now. The overall view looks like frosty, as if you have done etching because there is a filter. जब ये filter हम इस पे mount करते हैं, तो ये filter सारा reflection block कर देता है, and you can see the actual shade under light without any reflection. So shade selection becomes cakewalk. And that is why in all our anterior cases where aesthetics is important, we compulsorily use Cocolux light. I hope you are clear with this. Then another light is Moby ring light. This light I use every day. This is from Unique Dental Innovations. The cost of this Moby ring light is around 10,000, but trust me, it is completely worth. First reason is you can mount your mobile here, and second is the light is great. The durability of this light is good. You charge it once, it runs for one month also. It is beautiful light, and you can use it for taking photographs of objects and subjects and sometimes intraoral. Then there are few small ring lights available on Amazon. I don't recommend it now. Earlier I used to use it. So this is how these ring lights are available. But I will very strongly recommend you to think about this light. Amazing light, totally worth it. I have 2 lights at my clinic. And this is how I use these lights to take photographs. For creative photos like this, golden rule ध्यान में रख लो, लिख लो paper पे. Whenever you want to take creative images in mouth, your flash should be switched off. Flash off रहेगी तो ही creative photos आएंगे. Just like this. With mobile flash on, you cannot take photographs like this. Mobile flash must be strictly switched off. Then only you can take photos like this. And backside में क्या है? Backside में एक अलग light रखा हुआ है मैंने. You know, दो हमारी रूफ में जो लाइट होता है बड़ा 12 वैट 10 वैट का कम से कम वैट वाला एक बड़ा स्क्वायर लाइट ले लो, उसे एक लंबा प्लग लगा दो, एंड यू कैन यूज दैट लाइट एज अ बैकग्राउंड लाइट. आपको बड़े बड़े डिफ्यूजर बॉक्सेस लेने की जरूरत नहीं. यू डोंट नीड टू स्पेंड 40,000 50,000 रुपीज. जस्ट 1,000 रुपीज का रूफ लाइट एलईडी लाइट लेकर आना है व्हाइट वाला, उसे एक लंबा वायर लगा दो एंड यू कैन यूज इट एज अ बैकग्राउंड लाइट. सो ऑल दैट बैकग्राउंड इज बिकॉज ऑफ दैट लाइट. एंड आगे से मैंने अलग लाइट्स यूज किए फॉर टेकिंग दिस फोटोज. यू कैन सी द डिटेल्स ऑन दिस ऑरेंज. So I was using a powerful light like this Moby ring light. Please look at this light. So I was using this light. My camera was here. I will show you. My mobile was like this, mounted on this camera, this light, and I was taking photos like this. So जब mouth पे ये light ऐसे आएगा, you will get a subtle light in lip region. And पीछे background में वो वाला light रखना है जो मैंने आपको अभी बताया है. Okay. So this is how you can see here. This image you have to remember. Please remember this image. ये background में मैंने एक light लिया है. You can see a long wire. 5 मीटर 3 मीटर का वायर लगा दो and front से मैंने एक ring light use किया है. That is how I got this image. Look at these images. Okay. Then you can use these lights for specimen, prosthesis photography. Not shade selection actually, but shade selection needs proper color corrected light, 5500 Kelvin light. That is Cocolux. But you can take a lot of good photos, model photos, specimen photos, impression photos by using all these lights. Okay. Even these photos, they are taken using those lights. So when it comes to light, please remember, आपका कोई भी intraoral photo अगर लेना है तो flash is necessary. This is taken with mobile flash. Okay, speckled leukoplakia case. बट ये लेना है तो मोबाइल फ्लैश वाज ऑफ. तो सिंपल रूल, इंट्राऑरल फोटोग्राफी करनी है, फ्लैश इज कंपलसरी, मोबाइल फ्लैश इज कंपलसरी. एक्स्ट्राऑरल फोटोग्राफी करनी है, मोबाइल फ्लैश ऑफ कर देना है. सिंपल रूल. ओके. So what we did is look at this mobile. It's a Oppo company mobile, and as I said, flash was very bad. Look at this image without flash. I will show you the image with flash. Dekho. This is what happens with most of the mobiles if their flash is over harsh or light is too much harsh. This is how you get whitewashed images. So what we did is we use these accessory lights, Mobi ring light and all you can use, and we took one photograph. This was the photograph. इस photograph को थोड़ा editing करते हैं, yellowish दिख रहा है, थोड़ा color change करते हैं, and you can see now it's look good. This is how it was exactly in patient's mouth. So editing is very important, but sometimes if your flash is not good, you need to take away the mobile flash and extra light use karo. And if you use light wisely, you can take a lot of beautiful intraoral and extraoral images. Also, I am admin of one of the Facebook groups called Mobile Photography, जहाँ पे 25,000 से ज्यादा members है. आप वो भी group join करो. All of you please join Mobile Photography group on Facebook to learn general mobile photography in day-to-day life. So we conduct a lot of competitions. So this photo was taken by me, and these are images. You can see how beautifully lights are used by our participants and members of the group. Okay. After that, the second criteria is retraction. Light का एक clear कर देता हूं मैं. Number one, your mobile flash must be good. अगर mobile flash bad है तो use external lights. Try to incorporate this Mobi ring light in your practice or Cocolux light. Cocolux के दोनों फायदे हैं, shade selection and light. Mobi ring light only for light. और फिर आप ऐसा कैमरा लो जिसका फ्लैश अच्छा है. सबसे बेस्ट आइडिया Note 10 Plus, the most important camera. Or you can check your camera. There are a lot of cameras, mobiles, which are good in photography. Now let's talk about second point, that is retractor. I don't know how many of you use retractors, but in India, a lot of clinicians don't use proper retractor. There are plenty of retractors available in the market. The simple retractor that you have to use is, look at this retractor. Simple transparent retractor for adults. These are transparent retractors for kids, or you can use it whenever patient has limited mouth opening. So separate retractor is what you have to use. Please do not use this kind of joint retractor. Strictly no to joint retractor. Never ever use joint retractors. Please remember. And this is how people do retraction. Whenever you put joint retractors in patient's mouth, the biggest problem is ये joint retractor जब हम mouth में लगाते हैं तो problem is you get a very closed view. पूरा drop हो जाता है lip का, and you will not able to take good maxillary and mandibular photographs. Look at these photographs. People use fingers also. They don't retract properly. So you need to understand, boss, that retraction is the primary element that you need for photography. If you don't retract properly, how will you get photograph? How will you get to record things inside the mouth? How will you cover maximum area? So retraction is like opening the door. Without opening door, you cannot ask somebody to come inside. So look at these images, two images taken with joint retractor and post-edited, and the other image is taken with separate retractor. The answer is here. Which is good? Which image looks good? Obviously, the bottom image looks great because retraction is beautiful. In top image, you can see everything looks close, and you can see even the mustache hair. That looks very ugly. I see this kind of hairs in many photographs. So showing mustache here is not a part of good photography. It's a bad photography. Second important point, I will now share you the most important tip. If you are not able to see the vestibule, your retraction is bad. Simple rule. Note it down. If you are not able to see vestibule of the person or patient, your retraction is bad. As simple as that. Whenever you are able to see the vestibule, retraction is good. So use separate retractors. They are very costly, 175 rupees or 200 rupees for a pair. You can buy it from different companies. There are a lot of companies, and they You will get it online also. It's available on Dental Cart as well. Retraction, look at these different retractions. You can always see the vestibule. Third molar area, always use a retractor, tongue depressor or mirror or any periosteal elevator to reflect the tongue. Any anterior photograph or third molar retraction should be done properly. Okay, you have to retract properly so that vestibule will be visible. This is the way to retract so that you can take beautiful images. And that is why retraction is very crucial in photography. Look at all these images, how retraction is done. Because of good retraction, I could take these photographs and I can show you everything inside clearly without any obstruction or hindrance, right? So please remember, when it comes to retraction, please use this separate retractor. This simple retractor costing 200 rupees will solve most of the problems. Third important part in photography is framing or composition. Now, this is the most important part where most of the clinicians do mistake. You know, framing or composition is very crucial in extraoral photography also. Like you are doing wildlife photography, portrait photography, you are doing event photography, you are doing urban photography, architectural photography. Framing plays a very major role. Framing के कुछ rules भी है. Rule of third, right to left, left to right, symmetrical, Fibonacci circle, like that there are many rules. But in dentistry, simple rule ध्यान में रखना है, center positioning. एक ही rule है. आपको जो area of interest है वो center में रखना है. यही composition है dentistry में. So what is composition or framing? In visual arts, framing is the presentation of visual elements in image, especially the placement of subject in relation to other objects. Or in simple words, I can tell you, framing can make an image more aesthetically pleasing and keep the viewer's focus on the framed object. Now look at these three images. I will clear these above points. Forget about the above lines, little bit complicated they are. Look at these three images. When you look at these three images, you know what it is, what they are trying to show. But look at the composition. It is not good. It is bad. If I have to take similar photos, now check out my composition. I would compose this shot like this. Isn't it beautiful? It looks good. Look at the other image. I would take extraoral smile photo like this. Look at the cast. I would take photograph of model like this with proper light, proper background. And this is called framing or composition. Always remember, when you are taking photos inside mouth, you see a lot of things. But what you see is not important. What you want to show is important. So look at these images of bad example of framing. Many of you might have taken such images. I hope from now onward you will try to frame your images properly, compose them properly. Look at this complicated framing. We don't want to frame our images like this. And the positioning is, look at the area of interest. The ridge is on upper right side. In fact, it should be in the center, right? Look at this composition, very bad. So I will show you some images where you will find good composition. Look at this. So the simple composition or framing rule in dentistry is the area of interest should be in the center of the image. That's it. And this is the most simplest form of composition in entire photography. Center composition. Look at these images. In all my images, the area of interest is in the center. But proper retraction, if there is blood, saliva, suction use karo and then only take photograph. Look at these images. Center composition. Look at these images. Everything that I want to show you is in the center of the image. I hope you have understood framing or composition. Same way, look at these non-dental photographs where composition is very important. This is called symmetrical composition. This is my image of rule of third. Zebra, the giraffe is at the right bottom corner and rest of the cloud is covered. This is called rule of third. Okay. Look at this reflection photography composition. So now we are done with light, retraction, composition. Next, we will move with focus and other points. Here, I want to take one break of 30 minutes. Deepa, we will come back at 9:35. It's 9:4, 9:5 almost. 9:35 will be back after dinner. So everyone, those who have come back from clinic or at home, please take your dinner, finish it, and we will be back at 9:35 dot. Okay?
Okay, sir. Yeah, done.
Thank you.
Well.
Deepa?
Yes, shall we start?
Yeah, we will start. We'll start with the questions first. Whatever
Okay.
questions are asked till now, we will take them one by one.
Okay, sir. So welcome back, everyone. Let's start with the question and answers. Sir, Dr. Sakshi has asked, while using retractors, how to take occlusal photos of patients. Sometimes patients feel stretching of lips while using retractors and intraoral mirror, or patients feel it is time consuming. How to handle that?
See, whenever you use retractors, along with retractors only, you have to use mirrors. But the mirror should not be large in size. You have to insert them properly. Retraction is compulsory. First rule you need to understand, whenever you are taking intraoral photo, retraction is compulsory. Even after putting retractors, you can place mirror. I am going to show those images, so wait for it, okay? And patients feel comfortable only if you put retractor properly, hold them properly. I will cover that. Don't worry. Mirrors में cover करूंगा.
Okay, sir. Sir, actually, I started from somewhere else. Dr.
Start
Ankita.
from disadvantage of iPhone.
Yes. Disadvantages of iPhone for photographs. Yeah.
See, only disadvantage I see is for other purpose, iPhones are great, but flash wise, I find them poor. Flash of iPhone is not good, and many times iPhones hunt for focusing. So if they don't know where to focus, if their auto focusing is not great, then there is a problem. Only for dental, I am talking about. In general, iPhones are good.
Yeah, Dr. Dinesh has asked, please tell if we keep distance at 40 centimeters and click after zooming in, will image will be compromised?
Yes. Always remember, only optical zoom is good. Digital zoom is bad. But when you are doing dental photography, you are not supposed to do zooming in mobile. Bring your mobile close to the mouth or away from the mouth. But do not zoom. The moment you zoom and take photos, you are compromising the image quality.
True, sir. So Dr. Shraddha has asked, room lighting is also sometimes too bright.
Usually room light doesn't affect your intraoral photos unless you have a you can say focused flashlight over the patient's head. Otherwise normal light, LED lights or roof lights, they won't interfere in your photos.
Yes, sir. Dr. Nishant has asked, nowadays phones come with different flash timings. How much exposure to flash is necessary?
See, the problem is using flash with timing is very difficult because in general DSLR photography we sync our flash with the shutter, but here with mobile it's difficult. So I don't recommend to set up timing for exposure. You just put your mobile in auto mode. Do not put your mobile in pro mode. Normal जो mode है उसमें जाना है, flash on करना है. That flash is by default synced with your shutter. So use that only. Don't go for timings.
Okay, sir. So Dr. Dinesh has asked, what is background light and why background light is necessary?
See, background light is important only when you are taking extraoral photos of lip or maybe veneers, crown, bridges. Creative purpose के लिए use करना पड़ता है so that you will get a white light in the background. You can hold a cloth, but cloth will not give you that illumination from background. So to get that white illuminated background, we need background lights.
Which mobile was used during this photography? Dr. Ankita has asked.
Yeah. I use Note 10 Plus since last 5-6 years. Till date, that is the best mobile. You can easily buy it from any dealer. Mainly, you will get refurbished or second hand. New is not coming. It is discontinued long time back. So try to get Note 10 Plus. Samsung Note 10 Plus.
So class 2 cavities with matrix band on photography is difficult. Any tips for that?
Yes, yes. The tip is first put a retractor. After your band and everything is placed, put a retractor and take photographs in the mirror. For that, you need a round mirror like your mouth mirror. I am going to show you. Just give me some time.
So Dr. Dwarka has shared some light. How's
That
this
light
light?
I have tested when it was introduced in India by Unique Dental, but I did not find it efficient. I told them that I can't use it and I will not tell anyone to use this. But still they are promoting, but I am not very happy with this light. I don't recommend this light. It is very heavy, very uncomfortable to use in front of patient. We need something very handy. So I am not comfortable with this light. I did not like it.
Yes, Dr. Sakshi has asked how to change camera settings of Samsung S26 for dental photography.
No, no, you have to use in auto mode only. Don't go into any settings. Pro mode and all is okay for non-dental photography. For dental photography, without any settings, just switch on your camera, flash on and go ahead.
Yes, sir. Sometimes screens are not coming showing what. Sorry. This is something related to.
Okay, that's different.
Yeah. So what camera settings are necessary? What should be the brightness setting while taking photographs?
Again, I'm telling you, most important thing, you just need to put your camera on, flash on. There are no other pro settings you have to use. Let camera do it by its auto mode. But on the camera screen, when you touch, there is a marker. You can adjust the exposure and accordingly take photos. But otherwise, you don't need to put camera on any particular setting.
So Dr. Roshni has asked, you wanted to know retractors for third molars, tongue, which you recommend.
For tongue and third molar, you can use Picard's elevator, Pricards, Picard's elevator, or any L shape or straight tongue depressor.
And also she wanted to know about clinic lights while taking photographs.
No, no, we are just keeping lights on. We are not changing them. We are not closing them off.
Dr. Sakshi has asked how to select angle of mobile while using retractor, how to keep a hand stable.
No. First thing is now I am yet to cover the plane. In plane, I will explain you. But remember again, when you are taking intraoral photos, you have to put retractor and you don't need to take support from anywhere. Sometimes I use this middle finger, rest it on patient's chin and then I support my hand. But otherwise, you have to keep your mobile steady. Steady hands का practice करना है. Photography में वो primary requirement है.
So you mentioned that intraoral, we need to switch on phone flashlight along with ring flashlight.
No. Whenever you are using any external light, whether it's a Mobi ring light or any other ring light, always switch off the mobile flash. Mobile flash on तभी रखना है जब आप कोई और light नहीं use कर रहे हो.
So Dr. Dipali has asked, does Cocolux light has camera grip and shoot button that can be connected to through Bluetooth?
No, it has camera grip, but it doesn't have any Bluetooth button or any other shoot button. You have to shoot it yourself.
Sir, Dr. Monik has asked, is there any software which can help us in documentation of patients' photos because all dentists' phones are packed with dental pics?
No, the thing is, whenever you take photos, immediately you should transfer it in a dedicated folder with patient's name on it. So I have thousands of cases distributed, categorized like that. We'll discuss that also. Don't worry.
Yeah, Dr. Neha is asking if I'm not getting Note 10, then the next reasonable option is.
You can try other phones in the market. I have list of phones. I will share it soon in the group. Don't worry.
And how about a unique mobile Mobi Flash Pro Flash?
I don't know if you're talking about that ring light. I have not seen that unique Mobi Flash Pro, but if it is like this, you can go ahead.
Uh,
Endodontic photo we are going to discuss. Don't worry. Aesthetic photos also we'll discuss. Don't worry.
Dr. Mushi is saying she has iPhone 14 Pro. Could you suggest any requirements with this phone so that I can start taking photos with this phone?
See, the problem with iPhone is only flash. If your flash is good, no problem. If flash is bad, you need to buy either separate phone for dental photography or you need to buy one of these lights so that your flash problem is solved.
Yes, sir. So, what should be position of patient while taking intraoral photographs?
Patient can be in any position, supine, semi-supine, postural, doesn't matter. Your camera should be parallel to patient's face. We will discuss that soon.
If I'm getting good flashlight, then do we need in ring light?
No, you don't need ring light then. But I use ring light for extraoral photos because extraoral photos are taken without flash. Extraoral photo के लिए mobile flash off रख देना है. So for that you need a subtle light. So this ring light is very helpful for taking extraoral photos of prostheses, models, materials, etc.
Dr. Ankita is asking if I use flashlight with iPhone, it will be okay for intraoral photograph.
Yes. If your flashlight, yeah, you can use it. No problem. It will be good.
Dr. Nida is asking, my phone has option
12
of
megapixel is more than enough. Don't go for 50 or 200. 50, 200 you can take outside for landscape or other photo where you want more details. Or sometimes if you are taking some exclusive photos of maxillary anterior for aesthetic cosmetic cases, smile designing cases, then you can take. Otherwise, we don't need so much of pixels. Normal photography 12 megapixel pe karo.
I'm having Samsung S24 Ultra. What is the ideal setting I should always do?
As I told you, if your mobile is not giving good photos at normal camera mode with flash on, you need to buy another camera.
What should be level of light while phone camera?
No, the light is coming from your mobile, na? So it's not a question of leveling it. It is fixed. But if you are using external light, it should be always from the front. And through that light, you have to take photo. That's why you need a ring light.
Camera settings for iPhone.
Yeah, same. Normal photo mode with flash on.
Yes, sir. How about OnePlus 15 for the photography? It has macro shot as well. Should we use macro shot for dental photography or
See, the
not?
macro shots are very shallow depth of field. They will focus only on one tooth, rest of the tooth will be out of focus. So for creative purpose, you can use macro shot to get details, but otherwise normal camera mode is useful. I have not used OnePlus 15, but most of the OnePlus mobiles are good.
So which mobile phones would you recommend for MDP?
I will send you the list in the group. Don't worry.
Which light do you recommend?
Yeah, I recommend this Mobi ring light buy. This is wonderful light, and I personally strongly recommend out of my own experience and use. It's very good light by Unique Dental or Delhi Dental. You can ask them.
Yes, Dr. Dinesh has just joined, and yeah, Dr. Dinesh, Dr. Akash has already answered your background light wala question. You can view it later.
Yeah.
Dr. Babli has asked how to use contraster.
I will talk about contraster. Don't worry. I'm going to talk.
So Dr. Roshni has shared some images.
No. They are not good. Simple.
This is a 12 flash. How to prevent contamination? Do we change gloves every time?
No, as I told you, if I am doing surgery, I'm not taking photos. My assistant takes photo. For non-surgical cases, you can use, no problem, mobile.
So for that, we need to train our assistants also.
Compulsory.
Yes, sir. So whenever I used mobile flashlight, the photos are overexposed and reflected light.
Because your mobile flash is like that. That's why the first criteria for selecting a mobile for MDP is flash should be good.
Do we always need to switch on the flash?
Yes,
it
for
compulsory?
intraoral photo, flash on is compulsory. Extraoral photo or any object specimen photo, flash off and use additional light.
So what about iPhone 17 Pro flash?
Frankly, I have not tested iPhone 17, but most of the iPhones nowadays have that problem. The flash is overexposing. It's very harsh for dental.
Yes, sir. I also had an iPhone and I kept it aside, and now I use the Samsung one.
Yeah.
So extraoral non-artistic photo like patient while smiling. Do we need ring light?
Yes, 100%. You need additional light, not specifically ring light, but any additional light source that is powerful from front, from camera, from mobile side. And opposite side, as a background, you need that light that I mentioned. Okay.
Yes, sir. If we can purchase only one extra light, which one would you recommend? Cocolux or Mobiring?
See, Cocolux is more for shade selection, less for photography. Mobiring is purely for photography. So you can go for Mobiring. It's very good.
Yes, sir. We are done. There was one question in the chat box also. Yeah, same it was.
Okay, so we'll go ahead. Whatever questions you have, we'll again take them. That is how everyone will get to know about everything. Okay, now remember, after light, retraction, framing. Light ho gaya, retraction ho gaya, framing or composition ho gaya. Now let's move on to next important point, focus. Focus kya hota hai? If I am looking at something and it is clearly visible to me, it's my focus. अगर मुझे blur दिख रहा है, means मेरा focus blurred है. Means there is some problem with the focus. Same way when you use camera and सामने रखते हो and you are trying to capture something, but camera struggles to focus. Camera doesn't know कहाँ focus करना है. Then there is a problem. But as I told you, कोई specific setting नहीं रखना है. iPhone हो, Samsung हो, Oppo हो, any phone आपके पास है. Camera on करो, flash on करो and go ahead with shooting. Auto mode. Camera has auto focusing जो खुद होके focus करता है. But what happens? The problem is camera doesn't know what you want. You know what you want. So if camera doesn't know what you want and camera focuses somewhere else, तो camera को help करनी होती है to understand कि आपको किस पे focus करना है. So I will discuss about that. Look at this image out of focus. Ideally, somebody wanted to focus on those paralleling pins, focusing कहीं और चला गया. Second point, देखो blurred image है. Whenever you have poor light, focusing कितना ही अच्छा हो, images blurred आते हैं. हमेशा ध्यान में रखना. Look at this image. Light poor है, blurred लगता है image. Look at this focusing. Proper focus नहीं किया and shot the image. Look at this image. Absolutely blurred. तो blurring होने का और एक reason है. Focused images क्यों नहीं मिलती है? Because you don't wait for camera to focus, or when you are taking photograph, your hands are shaking. That can be reason for images out of focus. Now, how to achieve focus? Please remember, आपका camera on करो, flash on करो and focus on the teeth. Let camera focus. Camera autofocus is amazing. 99% it will focus on the area of interest and then you shoot. Now suppose आपने camera on किया and you are trying to shoot something, but camera उस teeth पे focus नहीं कर रहा है, lip पे कर रहा है. So what you will do? You increase or decrease the distance from the mouth. 5 centimeter आगे पीछे जाओ and your camera will focus. This is best way. तो पहला way है auto focusing. Rely on that. 90-95% it will work. If 5%, 2% chances कि नहीं focus कर रहा है, then take your camera close or away from the mouth and camera will focus. कभी-कभी camera को एक specific breathing distance लगता है to focus on a particular area. Third है हमारा smart camera है, तो just touch the screen. The moment you touch the screen, camera will come to know कि कहाँ पे focus करना है and it will focus. And best part जो मैं करता हूँ is point number 4. Try combination of all this technique. Means camera निकाला, focus on the teeth, focus नहीं कर रहा है, थोड़ा आगे पीछे जाओ और touch the screen. So distance कभी-कभी adjust करना होता है और touch the screen on the camera and tell camera this is the part where I want to focus. So this is how you can achieve good focusing. तो कई बार focus नहीं होता है तो लोग ऐसे ही फोटो ले लेते हैं. They don't even see camera focus कर रहा है कि नहीं. My assistant was trying to take this photo and देखो क्या हुआ, topography is out of focus. I told her थोड़ा distance आगे पीछे करो and next shot was bang on. Photo, you can see the topography is clear. Look at this. I was trying to capture that implant, but implant is out of focus. Camera ने focus किया पीछे. So I adjusted my distance and the next shot was clean. That is how you have to tell camera. See, everything is out of focus. बहुत बार ऐसे होता है. तो आपको कैमरा स्टेडी रखना है, स्क्रीन पे टच करो. Tell camera, I want this part. And the next shot is crystal clear. Look at this implant. This is how you have to improve your focusing. So whenever you are trying to take any photo, see to it that when you are when you keep this screen on, I will keep this screen on. Look at this screen. You have to see to it that जो part आपको capture करना है, it is in focus, like this. Then only take a shot. Okay. Look at this. Even this is out of focus. I will show you the clear image. You can see now. I will go back. Check again. So this is very important. Focusing help करना है camera को. Totally you can rely on autofocus mechanism of camera. Camera properly focus करता है, but many times आपको distance adjust करना है. Either go close or away. That is how camera will focus clearly. And never ever press the shutter button without achieving focus. Look at all these images. Everything is in focus. उसके बाद ही मैं shoot करता हूँ. Suppose I am taking photograph of multiple things like this 5 lab analogs. मैं उसका photo ले रहा हूँ and my camera is focusing only on 1 or 2 lab analogs. Rest are out of focus. होता है ऐसे. तो just go little bit away. जैसे दूर जाओगे, camera will increase its depth of field and it will focus on all lab analogs. These are general images from our group only. You can see how the focus is achieved. This is shallow depth of field. Focus एकदम achieve किया. This is my image. You can see eye is focus, rest of the part is out of focus. So इस तरह focusing करना है. Especially for dental, please remember, you switch on your mobile camera, flash on करो and hold the camera until and unless camera focuses. Distance adjust करो but don't shoot if your camera is not focusing. Now try to understand what is depth of field. Look at these two images. In left side image, the girl is focused. Background is out of focus. ये तब होता है जब आप डिस्टेंस दूर रख के जूम करते हो कैमरे से और आपका पोर्ट्रेट मोड जो होता है ना, पोर्ट्रेट लेंसेस, वो लेंस आप यूज करते हो विच इज वाइड एपर्चर f2, f1.4, 1.8, 1.2. ये वाली लेंसेस में क्या होता है, सब्जेक्ट फोकस में होता है, बैकग्राउंड आउट ऑफ फोकस. जैसे एपर्चर बढ़ाओगे आप तो आपका फोकसिंग डीप हो जाएगा. डीप होगा मतलब सब्जेक्ट, उसके पीछे जो भी है सब क्लियर आ जाएगा. दैट इज व्हाई इन एसएलआर मैं जब वाइल्ड लाइफ में जाता हूँ, मैं शैलो डेप्थ ऑफ फील्ड पे शूट करता हूँ, f2.8, f4, f5.6, ताकि मुझे सब्जेक्ट क्लियर आए, बाकी का बैकग्राउंड क्लटर जो है वो क्लियर हो जाए. बट डेंटल में वैसा नहीं है. डेंटल में क्या होता है, वी वांट ऑल टीथ इन फोकस. इसका मतलब हमें डेप्थ ऑफ फील्ड शैलो नहीं, डीप चाहिए, राइट? तो विल क्लिक दिस. ओके, ये देखो डिस्टेंस आप जैसे जैसे क्लोज जाओगे, जूम करते जाओगे, क्या होगा, सब्जेक्ट क्लियर होगा, बैकग्राउंड ब्लर होगा. ओके, और आपका एपर्चर बड़ा होना चाहिए. बट मोबाइल में क्या प्रॉब्लम है, ये देखो मोबाइल में भी या कैमरा में भी 2.8 के एपर्चर पे सब्जेक्ट आपका शैलो डेप्थ ऑफ फील्ड होने की वजह से क्रिएटिव इफेक्ट आता है. वही आप f11 देखो कैसा है, सब क्लटर आ गया. तो इन डेंटल फोटोग्राफी वी वांट अ डीपर डेप्थ ऑफ फील्ड, बट हमारे कैमरे का एपर्चर बाय डिफॉल्ट बढ़ा दिया है. मतलब f2, f1.7, 1.4 है. मतलब ये है कि आपकी इमेजेस बाय डिफॉल्ट शैलो डेप्थ ऑफ फील्ड में आ सकते हैं. तो हाउ टू टैकल दैट, सिंपल एग्जांपल दे रहा हूं. ये देखो मैंने एक फोटो लिया, इसमें आप देख सकते हो कि ओनली लैटरल इंसाइजर्स आर क्लियर, सेंट्रल इंसाइजर इज क्लियर, मैंडिबुलर कनाइन टू कनाइन इज क्लियर, रेस्ट ऑफ द टीथ आर ब्लर्ड, आउट ऑफ फोकस हो गए. व्हाई? बिकॉज डेप्थ ऑफ फील्ड शैलो है. तो आई डोंट हैव एनी मैकेनिज्म कि मैं अपना एपर्चर बढ़ा लूं. प्रो मोड में मुझे जाना नहीं है, दैट इज वेरी कॉम्प्लिकेटेड. तो हमें क्या करना है, कैमरा को थोड़ा दूर ले जाना है. जैसे कैमरा माउथ से थोड़ा दूर ले जाओगे, 10 सेंटीमीटर पे हो तो 20 पे चले जाओ, 30 पे चले जाओ, तो क्या होगा, डेप्थ ऑफ फील्ड डीप होती जाएगी. लुक एट दिस नेक्स्ट इमेज. Depth of field deep हो गई, then shoot the image. This image looks better than this one because इस image में left and right में देखो posterior teeth are blurred. Okay, so this is very important point. All these images are clicked in shallow depth of field. मैंने क्या किया, सिर्फ कैमरा क्लोज लेके गया. कैमरा जितना क्लोज जाओगे, कैमरा जो क्लोजेस्ट सब्जेक्ट है उस पर फोकस करेगा, अपने आप दूसरा सब्जेक्ट आउट ऑफ फोकस हो जाएगा. बिकॉज आप जैसे क्लोज जा रहे हो, कैमरा शैलो डेप्थ ऑफ फील्ड में जा रहा है. तो शैलो डेप्थ ऑफ फील्ड मींस जो सबसे एक थिन लेयर होती है फोकसिंग की, जो पास में है या क्लोजेस्ट है उस पर फोकस होगा, पीछे वाला या एकदम आगे वाला आउट ऑफ फोकस चला जाएगा. तो व्हेनेवर यू वांट क्रिएटिव शॉट, क्लोज जाके शूट करो. जब नॉर्मल शॉट चाहिए जिसमें सारे टीथ आने चाहिए, तो गो लिटिल बिट बिहाइंड, दूर से लो. लाइक दिस इमेजेस, डेप्थ ऑफ फील्ड इज लार्ज because I wanted all sutures to be visible. I wanted all tissue topography to be visible. And look at this, all lab analogs are visible. You can see even this gingival masking material being poured inside the impression. So this is how, जब depth of field आपको shallow चाहिए, close जाके फोटो लो. Otherwise 20 to 30 सेंटीमीटर का distance मैंने बोला है, which is good to give you large depth of field. Look at this image, large depth of field. Large depth of field, shallow depth of field, only that dal part is visible or clear and the chapatis behind are blurred. Look at this shallow depth of field, right? So that is how depth of field is important. But in dentistry, for dental documentation, we don't want shallow most of the time. We want deeper depth of field. Second point is sharpness. Now the magic of sharpness is, sharpness and focusing goes hand in hand. मतलब फोकसिंग अच्छा है तो बाय डिफॉल्ट इमेज शार्प आएगा, राइट? बट लाइट का भी रोल होता है. अगर लाइट आपका नहीं है और आपने फोकसिंग अच्छा किया तो भी इमेज शार्प नहीं आएगा. तो व्हाट इज शार्पनेस? शार्पनेस का मतलब क्या है? शार्पनेस मींस द इमेज और द डिटेल्स इन द इमेज हैव क्रिस्प एंड क्लियर एजेस. लुक एट दिस, लेफ्ट साइड का इमेज देखो, मतलब आई वुड से दिस इज नॉट वेरी शार्प, क्रिस्प नहीं है. लुक एट दिस इमेज, यू कैन सी एवरी डिटेल, एवरी मार्जिन. Look at these two images. कौन सी sharp है? Which image has more crisp and clear edges? So image on the left, right side has more crisp, clear edges. That is why it is sharp. So sharpness depends on many factors. These are not sharp images because इसमें light missing है, focusing missing है. तो अच्छा light and अच्छा focusing आपको sharp image देता है. Keep camera flash on. Good flash is mandatory. It's compulsory for sharp images. Hand steady होगा, movement नहीं होगा तो blurring नहीं आएगा. You will get sharp images. Aperture जितना बड़ा, by default mobile के aperture बड़े होते तो you don't have to worry. Let camera focus manually and then click. Always try to achieve a good focus. Focusing and flash or focusing and light. These two factors will give you sharp images. Look at these images. All these images are sharp. The crisp, the edges, detailing have crisp and clear edges. You can see these are sharp images. Look at this. You can clearly see the edges, right? This is shallow depth of field, but anterior teeth have sharp. Top shot of anteriors. Look at all these images. They are sharp. You can see the border, margin of everything. Okay. After sharpness, next point is plane of an image. दिस इज वेरी इंपॉर्टेंट पॉइंट. मैं जब भी इंडियन डेंटिस्ट का डॉक्यूमेंटेशन देखता हूँ, आई फाइंड दिस फैक्टर मिसिंग ऑल द टाइम. सो सपोज आई वांट टू टेक फोटोग्राफ ऑफ maxillary and mandibular anterior. My mobile should be exactly parallel to the plane of the face, like this camera. But if I change the plane of my camera, angle of my camera, the same image will look weird and different. Look at this preoperative and look at this post-operative image. They are taken in the same plane. तो patient किस position में doesn't matter. Patient standing है, sitting है, supine है, semi supine है, it doesn't matter. आपका कैमरा patient के teeth के साथ जो एक plane बनेगा उससे match होना चाहिए. Simple rule है. Look at these images. Pre and post अगर same plane में होगा तो it will be easy for your viewer to understand what you have done. Now look at this image. मैंने एक image लिया है like this. This patient has a deep bite. Okay, this is pre-op image. Now, during intraoperative procedure or post-operative or maintenance, अगर आपने angle change कर दिया आपका, तो सेम इमेज ऐसे दिखेगा. If you change angle like this, same image will look like this. Means just change in the angle of the camera or mobile, your images appear different. In my clinic, in my case, what I do, I always match the plane of the mobile with patient's face. Doesn't matter patient 2 साल बाद आता है, 3 साल बाद आता है, मेरे सारे images same plane में होते हैं. Look at this pre-operative image. पोस्ट ऑफ ऐसे ले लिया आपने, इट डजंट लुक गुड. और ओवरऑल प्री एंड पोस्ट की बात नहीं आती है. व्हेन इट कम्स टू द ओवरऑल वर्कफ्लो ऑफ द डॉक्यूमेंटेशन, देयर वोंट बी एनी कंटिन्यूटी. आपके इमेजेस अलग अलग दिखेंगे. सी, प्री एंड पोस्ट विल लुक लाइक दिस. हाउ डू यू वांट इमेजेस? आई वांट माय प्री एंड पोस्ट टू बी टेकन इन द सेम प्लेन. Then only it will be easy for your viewer, your patient, your client, your colleague to appreciate what you have done in the case. Plane of an image. Again, look at these images pre and post. Okay. Look at these images pre and post. Now check this image. There was some perio problem. Look at the probe. Background is again black. I will discuss about it soon. Look at the suturing. All images are taken in one plane. Look at this another case. Whether my pre, intra, post op, all images are taken in one plane. So what happens when you take images in one plane, one angle mein lete ho, so there is a continuity or storytelling in your images. And that is why it is very easy to understand. Look at this case. All images of mandibular right posterior region are taken in one plane. So when you take images in one plane, it's very easy to understand for your operator or your viewer that the story or the case or the process is like this. It's very easy. And this image, just look at the images. Every image is taken in the same plane so that there will be a storytelling in this case. And that is why plane is very important. When you are documenting, see to it your mobile is not positioned like this, but mobile का camera जो है, वो camera patient के face के सामने होना चाहिए, so that you will get a bilaterally symmetrical view of patient's oral cavity, especially when you are taking anterior images. I hope you have understood in simple words what is plane of an image. Now let's move on to mirrors for dental photography. See, there are plenty of mirrors, but remember there is something called front coated and back coated mirror. Back coated are bad mirrors because उनका reflecting surface back side पे होता है, जो हम normally use करते थे. Look at this regular mirror. This is a back coated mirror. Front coated mirror means the reflecting surface is on the front side. So when light is hitting on the reflecting surface, जब उसका reflection आता है, there won't be any distraction. So dimensionally means you can see that image looks same. There won't be any distraction. Okay. That's why you have to always use front coated mirrors. And in that, I very strongly recommend this kind of metallic mirrors. You all can see these are metallic mirrors and they are from Kush Mahajan, Jalandhar Surgicals. You can call them if you want. I will put up the number. And these are the latest mirrors that I use every day. These are round mirror, just like your mouth mirror. They have a handle, metallic handle. And these are metallic rhodium or zirconia coated mirrors. These mirrors give you excellent quality photographs. I will show you the photos. So buy these mirrors. They are amazing. So mirror should be front coated and even in mirror you may get blurred image. So again mirror भी रखते हो तो focusing पे ध्यान रखना है. See to it that your camera is focusing. उसके बाद ही shoot करना है. Look at this mirror image. It doesn't even look like a mirror image. Look at the clarity. So you have to always clean your mirror with muslin cloth or paper. Soft tissue paper is the best ingredient or material to wipe your mirrors. Okay. Look at this mirror image and how clear and clean the image is. So when you put retractors, you have to put mirror in mouth. After putting mirror, patient will definitely breathe through mouth and you will find a fog. So जैसे mirror रखते हो, your assistant should use 3-way syringe to put air on the mirror. थोड़ा corner में कहीं पे mirror पे air मारोगे तो fog चला जाएगा. It's not a big. यहाँ पे भी देखो fog आया है. But later on I took photograph without fog. Just put the air and fog will go away. Okay. Background. You can give beautiful backgrounds in your images. That looks beautiful. I will discuss how. Look at this tissue topography. or maybe this arch, how clear and clean this image is, right? So when you focus, remember, whenever you put mirror in patient's mouth, rest of the criteria are same. Plain, focusing, सब पे focus करना है आपको, and you will get clear images. Endodontic documentation is quite easy. This is the case done by my wife. She does great endo work, and you can see the apical seal, and then I will show you the obturation. So most of the job in endo is done by X-rays. So focus on taking good X-rays. See to it that your X-rays are taken in the same plane. These are images by Dr. Ganesh Moria. He is wonderful endo expert. He is taking workshops also, and I see a lot of his cases with good documentation. There is another doctor, Birajdar from Aurangabad. He also does good endo. And these are MDP images by my course participant, Dr. Nitin Jain, who is endodontist. After workshop, he started sending me these photos, and look at the beauty of these images. They are very clear. Somebody was asking how to take photos after putting matrix bands and all. So first is you have to put retractor, compulsory. After retractor, use a good mirror. Maybe this kind of 3 centimeter or 5 centimeter mirrors will help you out. Use these mirrors and you will able to take good shots. So I don't recommend these Zerk mirrors now. You can use these metallic mirrors. They are good. But whenever you put mirror in mouth, always see to it that mirror is hold in this way. You have to hold mirror like this so that the area of interest will be in the center of the mirror. And then you can shoot. Although this is not a great image, you can take much better images. These are just demonstrations how to put keep mirror. But these large mirrors are very helpful. You keep it in the mouth like this after putting retractor and quickly take images with one hand. Means your mobile should be hold like this in one hand. Always remember these two fingers, middle and ring finger पीछे जाएगा and index finger and little finger में mobile को ऐसे hold करना and thumb will be free. Look at this. This is not the way to take good endo shots or intraoral images. Look at these photographs. Mirror is bad. You should use dedicated photography mirrors. They should be clean like this. Then only you will get crisp details. Image background. If you see most of my images with anterior region work, like composite, veneers, crown and bridges, implants, or any other pathology or any other issues, I always give background, right? That black, white, gray background looks really beautiful. It really takes out beauty from your image. It takes, means adds beauty to your image. It takes out all the clutter from the background, right? You can see here all the clutter is gone. This can be done by two ways. There are two ways. Either you learn editing or you can use this, but this is the bad way. Contraster. You know, the worst problem with this contraster is already you are putting retractor in mouth. On the top of it, when you insert contraster in mouth, it's very irritating for patient. Patients will feel like you are torturing them. So I don't recommend. Better you learn editing. Within 1 minute, 60 seconds, you can give black or white background. You need to learn Photoshop. In our live one-to-one workshops, we teach editing for complete 1 day. Whole day we learn editing on Adobe Photoshop. It's very easy to learn. You can learn it from anyone who knows it. Okay, or you can use contraster. But again, putting contraster in mouth is tedious. It's not easy. Every time it doesn't fit properly. I would very strongly recommend you to learn editing. Anybody can learn editing. It's very easy. Tilt correction, as you know, we can always correct the rotation. It's available with almost all softwares. You can rotate the image the way you want. Customized rotation can be done and you can correct the rotation. Even if the portrait photos are not good, you can correct the rotation. Even this much tilt can be corrected like this. It's not a big deal. It's available in software. Now, let us talk something about shade selection. As we all are doing cosmetic aesthetic cases, smile designing cases, and shade selection is a very crucial part of our practice. Let's try to understand in simple way. You need to understand three main attributes: hue, value, and chroma. Okay. So what is hue? Look at this color spectrum: green, yellow, red, purple, violet, all these blue, all these are different hues. right? U means color. Value means brightness or darkness. Look at the arrow. This is dark, this is bright. Dark, bright. So any color which is dark is value is less. Bright is value is more. Chroma. Chroma means saturation. If the saturation is less, minimal, it's a less chroma. More saturation, more chroma. Okay. So U is color, value is brightness, chroma is saturation. तो लुक एट दिस इमेज. मैंने एक पेशेंट का इमेज लिया मोबाइल से और कैमरा से, एसएलआर से और मोबाइल से. दैट कलर इमेज इंडिकेट्स यू. टीथ एज वेल एज गम्स का कलर दिखा रहा है, राइट? उसी इमेज को अगर ब्लैक एंड व्हाइट में कन्वर्ट कर दोगे, दैट इज वैल्यू. सेम इमेज को ब्लैक एंड व्हाइट कर दो, इट बिकम्स वैल्यू. वैल्यू मीन्स ब्राइटनेस एंड डार्कनेस, राइट? ब्लैक एंड व्हाइट इमेज. अब वापस पहली इमेज पे जाते हैं, यू वाली. उसमें आप ब्राइटनेस कम करो और कॉन्ट्रास्ट बढ़ा दो. ब्राइटनेस कम, कॉन्ट्रास्ट ज्यादा, तो आपको मिलता है क्रोमा, सैचुरेशन देखने को मिलेगा. नाउ लुक एट दिस टू इमेजेस, यू एंड क्रोमा. यू की इमेज जो इज अ नॉर्मल इमेज, बट व्हेन यू गेट द क्रोमा, you can see that the saturation of color is more at the cervical region, and you can see the translucency is up to mid level. This is how lab will come to know. That's why मैं जब भी ऐसे cosmetic cases होते हैं, क्या करता हूँ, I will show you. Before that, let's try to understand shade selection can be visual or instrumental. महंगे वाले instruments मत लो, they are not accurate. You can rely on your own judgment of shade selection. Though we always use Vita Classical, and I am sure आज जितने लोग सेशन में हैं 90% लोगों के पास 3D Master नहीं होगा. 3D Master is very easy in fact, and it gives you accurate shade. And आप लैब को कन्वे कर सकते हो that boss my shade is 2M2 or 2M3 or 2R1 2R2, because you can see यहाँ पे दिख रहा है आपको 1 2 3 4 5. 1 is M, 2 LMR. L is lighter shade, M मतलब medium, R is reddish, darker shade. आप देखो उसमें लाइट डार्क और दोनों का एक मीडियम पार्ट है. 3 में देखो LMR है, 4 में भी LMR है. तो लाइटर शेड, डार्कर शेड एंड दोनों का कॉम्बिनेशन. सो एंड एक और देखो इसमें क्रोमा, टॉप टू बॉटम देखो, क्रोमा इज इंक्रीजिंग. नीचे आते हो ऐसे डार्क होता है. सो दिस शेड गाइड इज डैम इजी एंड वेरी गुड फॉर शेड सिलेक्शन. You just need to buy it and it's very easy to select the shade. Okay, there is another system, Vita Linear Guide 3D Master, but I have never used it. It's very costly and technically thoda tricky hai. So leave it. You can simply rely on Vita Classical or 3D Master. So Vita Classical ki jo shade guide hai, you should not arrange it according to chroma. This is arranged according to chroma. Bright to dark, bright to dark, A1, A2, A3, A4, B1, B2, B3, right? We have to arrange it like this. कैन यू सी? सारे स्ट्रिक्स चेंज कर दो एंड आप क्लिनिक में परमानेंट मार्कर से यहाँ लिख दो दैट फर्स्ट शेड इज B1, सेकंड इज A1, थर्ड इज B2, देन D2. लुक एट द ओवरऑल ब्राइटनेस टू डार्कनेस. So you have to always arrange your shade guide according to value, not chroma. B1 is the brighter than A1. And darkest क्या है? You can see C4 is darkest, not D4. For patient, value is very important. Value correct आनी चाहिए. Slightest error in chroma will go unnoticed, but obviously you have to focus on hue and chroma also. But थोड़ा value पे ध्यान देना. Bright या dark जब teeth होता है, patient immediately point out करेगा. Now, when it comes to shade selection, you need a proper light. This light will cost you 30,000-40,000. I don't know how much, but it's very costly. I recommend Cocolux light. Cocolux light is something which every practitioner should buy. आपके पास एक तो भी color corrected light होना चाहिए. I have 2 Cocolux lights, one for consultation, one for clinic, and it's amazingly helpful, especially with this polarized filter. I have already shown you. Look at this A3.5 and C3 shade. ऐसा लग रहा था कि दोनों close है, दोनों match हो रहे हैं. But when we checked everything under polarized filter, we were clear that in this case, look at this, A3.5 and A3 shade, and under polarized filter, which one looks better? I think A3.5 goes close to it, right? Like in this case, look at A3.5 shade and look at this shade A3. So A3 is obviously brighter. Here you can make out, but here you can see A3.5 goes very close to the shade. So I would go ahead with A3.5. So like that, shade needs to be communicated either by written, or you can take photographs with DSLR or mobile, or directly select the shade and tell that to your lab that boss, this is the shade. Show the photographs to the lab that your shade guide is matching with the teeth. Look at these different shade selections without flash, A3 without flash, with flash, and with polarized filter. It's not the right shade, right? Second देखते हैं 3M1. 3M1 is slightly closer, and look at 4M1. 4M1 is more closer. In fact, 4M1 is the most accurate shade. तो मैं जब भी शेड सिलेक्ट करना होता है, मैं एक विदाउट फ्लैश, विथ फ्लैश एंड अंडर पोलराइज फिल्टर फोटो लेता हूँ. देन आई जज विच इज क्लोजर. ओके, आई वांट टू शो यू दिस केस. यू हैव ऑलरेडी सीन. इस केस में शेड एकदम क्लियर था पेशेंट का. इट वाज B3, जबकि B3 इज नॉट अ नॉर्मल शेड. हम लोग नॉर्मली hardly B3 select karte, but look at the match. A1, A2 was quite bright, and that's why the shade was matching like this, especially patient's face. Now look at the shade. B3 is going so well, right? And now the next case is again same case that we have seen earlier. Her shade was crystal clear. It was A2. You can see without flash, with flash, under polarized filter. And that is why I will show the final photos. We have already seen this case. You can see shade match was perfect, right? Patient was happy. Now, let's look at the third case where shade match was most tough. Yeah, look at this case. So this patient had trauma on like central incisor. Patient's tooth was painful. So we had to do root canal because it was painful. And then we prepared the tooth and selected shade. According to me, shade was A3. So A3 shade without flash under room light, A3 shade with flash and under polarized filter. And this was not enough. I took photograph and sent it to lab. This is the U value and chroma. And I also took one photo and sent it to lab that when you prepare a crown, add cervical patch like this. Body shade is A3 and rough body surface and incisal translucency should be natural. I want you to see the final output. Look at this case. Look at the final prosthesis. It looks so natural, especially in patient's mouth. You cannot even make out. So this is the beauty of shade selection. Last case, patient was a Bruxer. I selected shade, it was A2, and the final shade was like this. Look at this. More than 8 years now, even today, the tissue and restoration integration is amazing. You can see these photos. This is a shallow depth of field taken with my mobile flash off with external light. Background was black because somebody was holding a black cloth, or even if black cloth is not there, you can select that area and put the color in editor. Editing aana chahiye. This case was the most tough case for us. Patient has maxillary prognathism and patient wanted just shade matching because he had some issues with this tooth and he is a classical singer. So look at the periapical lesion. So endo was done. After endo, I selected shade. You know, 5M2 is the darkest shade in 3D Master. But still that was not going 100%. This image is with flash. This is under polarized filter. So I told my lab, see, this is the shade. अब इसमें आपको खेलना है, थोड़ा और dark कर दो. And lab has done the same job. Can you see 5M2 के साथ match करके उन्होंने दिया मुझे. And when we cemented, you can see the beauty. Now the crowns are looking good. You can see the shade match. So this is pre and post, zirconia crown. Okay. Obviously, Emax was used for characterization. Now let's move on to extraoral images. Do not take extraoral images like this. Strictly no. Like for intraoral images, I told you 30 centimeter, 20 centimeter pe aap kheloge. Distance will be 20 to 30 centimeter. For extraoral photo, 2 to 3 feet away from the patient. You should be 2 to 3 feet away and take photos. While taking photos, your camera should be parallel to face of the plane. A patient's facial plane. Body plane नहीं, face plane के साथ match करना है. 2 to 3 feet away. Lateral profile view hardly we need, but whenever you take lateral profile view, lateral profile of the patient should be visible. We hardly take these photos except ortho. We don't need these photos. Never take photos like this. You should always able to see the profile. Now let's see how to get this effect in portrait photography. Okay. So there are soft boxes or flashlight which are used for diffusion in DSLR photography. I have come out with this beautiful ring light. This is 18 inch, 18, 18 इंच रिंग लाइट. 18 इंच का लाइट लेना है आपको. ये अमेजोन पे अवेलेबल है. डिजिटेक, कोडैक, न्यूवर, अलग अलग कंपनीज के लाइट है, बट यू कैन बाय एनी ऑफ देम. ट्राइपॉड के साथ आता है. वन टाइम इन्वेस्टमेंट फॉर क्लिनिक. यू मस्ट बाय इट. And you can take beautiful images like this. I will show you. All these images are taken with ring light. So ring light on karo. Ring light में से mobile पकड़ के photo खींचो parallel with the patient's face. Okay. And look at these images, pre and post. All images. This ring light gives beautiful. And obviously, when you are using external light, mobile flash will be off. It goes without saying. So we every day take photos pre and post with ring light. And you can see how beautiful it looks pre and post. Okay. So you can buy this 18-inch ring light. You can take a profile shots also. And you can also use this ring light for some object photography. It is bendable. You can bend it. You can also make a customized soft light for patient's photograph. This is how you can use a light. Okay. And उसे एक बड़ा wire adjust कर दो. You like this and plug डाल दो. And plug and play. It's a beautiful diffuse light. You can use it for photography and for giving background also. Never take photos from a close distance. If you use light wisely, you can take beautiful images of your patients. Same guy, look at this photo. तो हर पेशेंट का एक फेशियल प्रोफाइल होता है. प्रॉपर एंगल से अगर लाइट यूज करोगे, पीछे ब्लैक बैकग्राउंड दे दो, यू कैन टेक गुड फोटोज. लुक एट दिस इमेज. These are photos taken with that same external light. You can get the good details. Look at this. Background में एक light लगा है, सामने से ring light है, and I got good photographs of the lip and the restoration. This is how you can take beautiful profile photos of patients. अंधेरा कर दो clinic में, black background का cloth and सामने से light. And with mobile only, you can take beautiful shots. Look at all these photos of my course participants, which I have taken over a period of last few years, maybe 8 to 10 years. Look at these photographs. You can see, look at all these photos. All of them are taken with mobile camera. Okay. You can take front smile and lip view, maybe better views. You can edit them. Look at these images. Okay, whenever you want to take extraoral means images which are not taken intraorally, you can switch off your light, extraoral light use karo. Object and specimen photography is very important in dentistry. Lot of clinicians take shabby images like this or like this. So first rule है एक अच्छा background cloth होना चाहिए. You cannot take photos anywhere. Look at these shabby images. You will never find any of my object specimen photographs like this. I never take photos like this. I always use background cloth. Pant piece लेकर आना है, 100 रुपए का आता है. Buy 3-4 cloths. I must be having. I will show you. Look at this white color. Navy blue is my favorite color. You can buy this cloths. 1 मीटर का बहुत बड़ा हो गया. Just उस पे एक सिलाई कर दो साइड से and use it. Look at these images. You will never ever find any of my prosthesis, specimen, material, object photograph without background. I never take photos without a good background. So simple, good background cloth can make your image more beautiful. Look at this image. That background cloth makes it so beautiful. This is on a tile. You can keep it on a tile. You can keep it on computer screen. Switch off करो, अंधेरा कर दो, computer screen पे रखो, and सामने से light लो, ring light, and you will get beautiful light, beautiful images like this. Okay, how to get this image? Don't keep it on mobile screen, keep it on a laptop screen. So you will get a reflection. सामने से light मारो and you will get beautiful. Or you can get a good reflecting black color का tiles. Look at all these images with background. So background is very important. and CBCT and X-ray images are ready-made images. उसमें कोई effort नहीं, but yeah, you have to take good IOPs. IOPs are very important. I will show you one image, one case. Look at this image. What is the most important thing that you observe here? Even the X-rays are taken in same plane. Just my judgment. There is no machine, no calibration. Just with the proper judgment and angle, every time I could take same angle photos. Almost, I will not say 100%, but they are taken in the plane. Editing for endo documentation, you can simply use X-rays like this. You can put some name, you can write down some captions and information and keep it for your patient. This is what I show to my patient. This is the level of endo work that we will do in your case. Look at these cases, or maybe this case, re-endo case. Look at how beautifully endo is done by my wife. Documentation, planning and storage. How to document a case? Now, टाइप ऑफ केस, आप सर्जिकल कर रहे हो तो आपके असिस्टेंट रेडी चाहिए. रेस्टोरेटिव और ऑर्थोडोंटिक केसेस यू कैन डॉक्यूमेंट. प्लान एंड विजुअलाइज एंटायर केस फ्रॉम प्री-op टू post-op टू follow-up. प्लान ऑल स्टेप्स एंड मेक अ नोट. एक नोट बना लो कि आपको किस किस फोटोज को रिकॉर्ड करना है. मिनिमम 3 to 4 इमेजेस ऑफ एवरी स्टेप. नेवर एवर टेक सिंगल फोटो. अगर आपने इंसिजन लिया है 3-4 फोटोज लो. रिफ्लेक्शन किया है 3-4 फोटोज लो. सुचरिंग किया है 4-5 फोटोज लो. बिकॉज आउट ऑफ दोस 4-5 फोटोज 1 or 2 फोटोज विल बी गुड. Learn about light. Light is everything in photography. Good retraction is the key to capture great intraoral images. Never ever forget that good retraction is the key. तो मैंने पहले ही बोला है, retractors proper use करो. Do not use joint retractors. Use separate retractors. 200 रुपए का आता है, 250 रुपए का आता है, ओरो और हैगर कंपनी का. Capture what you want to show. Don't capture what you see in the mouth. Frame or compose every shot properly, every step properly. Isolate and retract unwanted part. Clean saliva, blood, leftover material before you shoot. And always keep your mobile fully charged, because if your battery goes out of toss, it goes out of juice, then you will be left with no other equipment, and your images will be different or may not get good images. So mobile fully charged rakho. Do's and don'ts of MDP. Get a good mobile. That's the primary requirement. Acha mobile means good flash. नेवर एवर यूज डिजिटल जूम. जूम कर करके फोटोज नहीं लेने हैं. 1x में ही लेना है, डायरेक्ट क्लोज और अवे जाओ. बट डू नॉट जूम योर मोबाइल कैमरा. नेवर यूज चेयर लाइट एज एन एक्सटर्नल लाइट सोर्स. चेयर लाइट हमेशा स्विच ऑफ चाहिए. ओके. फ्लैश इज कंपल्सरी. इफ नॉट गुड, यूज एक्सटर्नल लाइट्स. एमडीपी लाइट लो, रिंग लाइट लो, मोबी रिंग लो, जो भी लेना है, बट यूज गुड लाइट. विदाउट गुड लाइट you will never get good images. Take images from closer distance. Save the pixels. मैंने आपको बोला है बहुत दूर से लोगे तो you will lose the pixels. Mouth के लिए 20 to 30 centimeter is a good distance. Keep your hands steady while taking images. Always keep lens clean. ये कैमरे के पीछे जो लेंस होता है, इसको क्लीन करके फोटो लो. If there are oil marks, dust marks, dust है उस पे, तो your images will appear bad, blurred. Set the focus for sharp images. I told you, sharpening and focusing goes hand in hand. So for sharp images, focusing अच्छा चाहिए, light अच्छा चाहिए. Remember retraction, frame, focus, plane. आप जब भी retract करते हो properly, framing, composition देख लो, focus हुआ कि नहीं check करो, and plane maintain करो. Spend quality time for editing your images. Editing सीखो. Try to understand framing. Composition is very important. डॉक्यूमेंट लाइक टेलिंग अ स्टोरी थ्रू योर इमेजेस. जस्ट 2 या 3 इमेजेस मत लो, पूरा केस सिलेक्ट करो, पूरी स्टेप्स को आप रिकॉर्ड करो. 8, 10, 15, 20 इमेजेस. मेरी फुल आर्च की केसेस के 120, 130 इमेजेस होते हैं. आई रिकॉर्ड A to Z स्टेप्स. स्टोर योर इमेजेस सिस्टमैटिकली. मेरी सारी केसेस सिस्टमैटिकली स्टोर होते हैं एक फोल्डर में, पेशेंट के नाम का फोल्डर. उस फोल्डर को डाला जाता है जिस स्पेशलिटी का केस है उसमें. Implant case, prosto case, perio case. Accordingly, we store patient's images. Understand light. Light is everything in photography, and nothing can beat your creativity. So keep thinking. नाउ वेयर एंड हाउ टू स्टोर योर वर्क, एक सिंपल टेक्निक बताता हूँ. आपकी मोबाइल से इमेजेस ट्रांसफर करो लैपटॉप और डेस्कटॉप में. उस डेस्कटॉप और लैपटॉप में एक मास्टर फोल्डर होगा, से उसका नाम है डॉक्टर आकाश. मेरा फोल्डर है डॉक्टर आकाश और मेरे क्लिनिक का नाम स्माइल स्टोन. उस फोल्डर के अंदर सब फोल्डर्स है, पेरियो, एंडो, ओरल सर्जरी, इम्प्लांट. इम्प्लांट का केस है तो इम्प्लांट के फोल्डर में पेशेंट के नाम के साथ जाएगा. इस तरह सेग्रीगेशन करना है, कैटेगराइज करना है, ऑर्गेनाइज करना है केसेस को. then only you will able to maintain good backup of all your cases. मेरे फोटोज कभी भी मोबाइल में नहीं होते, दे आर ट्रांसफर्ड इन द डेस्कटॉप और लैपटॉप. एंड देन उस डेडिकेटेड फोल्डर में से मैं इमेजेस लेके उसको एडिट करता हूँ, केस बनाता हूँ. आई विल सिंपली टेल यू व्हाट इज रॉ वर्सेस जेपेग. अगर आप फोटोग्राफ लेते हो, मोबाइल के सेंसर में इमेज आके जैसी की वैसी स्टोर होती है, दैट इज रॉ. रॉ इमेज इज वेरी हेवी, और फ्रैंकली स्पीकिंग डेंटल डॉक्यूमेंटेशन के लिए यू डोंट नीड रॉ इमेज. आप जेपेग इमेज लो. जेपेग इज द स्टैंडर्ड फॉर्मेट ऑफ द इमेज. आप जितने इमेजेस डेली शूट करते हो वो इस फॉर्मेट में स्टोर होती है, जेपेग. और भी फॉर्मेट्स होते हैं, पीएनजी फॉर्मेट होता है, टिप फॉर्मेट होता है, बहुत सारे फॉर्मेट्स होते हैं. बट जेपेग इज अ स्टैंडर्ड इंटरनेशनल फॉर्मेट जिसमें हमारी इमेजेस स्टोर होती है. आप उसी को यूज करो. रॉ इमेजेस का आपके लिए कोई यूज नहीं है, वाइल्ड लाइफ के लिए ठीक है. Now, the last important part of this session is editing. Okay, what is importance of editing, and is it a lengthy and complicated procedure? So let me tell you. First of all, जब भी मैं फ्री होता हूँ, मेरे पास टाइम है, मैं मेरे फोटोज एडिट करता हूँ. एडिट करने का बेनिफिट है, मेरा केस रेडी हो जाता है, एंड आई गेट टू लर्न मोर अबाउट व्हाट आई हैव डन इन पेशेंट्स माउथ, वेयर आई नीड टू improve next time. So editing is way of revising your cases again and again. So in my clinic, I use Adobe Photoshop and PowerPoint. For wildlife, I also use Lightroom, and एक Snapseed करके मोबाइल ऐप है, but I don't use it for dental documentation. Snapseed I use for travel photography, portrait photography, उसके लिए यूज करता हूँ. But mainly Adobe Photoshop is the editing tool. Always remember Adobe Photoshop, and PowerPoint का थोड़ा बहुत यूज कर सकते हो, but mainly Adobe Photoshop आपको सीखना है. I believe editing is makeup tool of an image. Look at this image. ये इमेज मैंने रात को फॉरेस्ट में लिया. इसमें आप क्या देख, क्लैरिटी नहीं है, बट इमेज वॉज क्लियर, बट देयर वॉज डार्कनेस. लुक एट द इमेज आफ्टर एडिटिंग. आई विल शो यू अनदर इमेज ऑफ द फ्रॉग एग. तो इमेज लेने के बाद हम लोग पहले एडिट करते थे. अभी एडिटिंग करने के पहले हम सोचते हैं हाउ इमेज विल लुक आफ्टर एडिटिंग, and that is how we capture image. Look at this frog. Inside that eggs, you can see a live frog. So this is the impact of editing. Look at these images. So editing is makeup tool of your image. It can take out mind-blowing details from your images. Look at these images, how beautiful they look if you learn editing. Editing is something that every dentist should learn, because dentistry has such a close relation with art. And art form mein photography is one of the best art forms, and that's why you have more chances of excelling in photography. Look at this image after editing. So अभी ऐसा होता है कि मैं इमेज लेने के पहले ही सोचता हूँ आफ्टर एडिटिंग हाउ इट विल लुक, एंड दैट इज व्हाई माय फोटोग्राफी बिकम्स बेटर. लुक एट दिस इमेजेस प्री एंड पोस्ट, कितना डिफरेंस है, प्री एंड पोस्ट. लुक एट दिस इमेजेस प्री एंड पोस्ट, प्री एंड पोस्ट लेबलिंग. Look at these images, pre and post. That's the beauty of editing. ये देखो इमेज, मैंने बैकग्राउंड दे दिया ब्लैक, एवरीथिंग लुक्स ब्यूटीफुल. एक बैकग्राउंड से आपका इमेज चेंज हो जाता है पूरा. ब्लैक बैकग्राउंड देना है, व्हाइट बैकग्राउंड देना है, यू कैन गिव एनी बैकग्राउंड विथ एडिटिंग. So that's why in my clinic, I don't need to put contraster in patient's mouth. I just take photograph and later on I edit it. So editing is very easy for me rather than putting contraster in patient's mouth. Look at all these mobile images that we have edited, black and white and color images. After editing, images always look better. Look at this image and after editing, right? So editing is very, very important. Anybody who thinks that photography is enough, no. Along with photography, you need to learn editing, because editing is makeup tool of image, but makeup can't make everything beautiful. Original image should be beautiful. What are the most common editing exercises? क्या करते हो आप? You crop your image, tilt correct करते हो, size adjust करते हो, heavy image को low resolution कर देते हो ताकि वो ज्यादा आपकी मेमोरी में स्पेस ना खाए. ब्राइटनेस, कॉन्ट्रास्ट, कलर एडजस्टमेंट, शार्पनेस डाल सकते हैं थोड़ा, गिविंग ब्लैक और व्हाइट बैकग्राउंड टू इमेज, रिमूवल ऑफ अनवांटेड पार्ट, कहीं पे थोड़ा सलाइवा है, लाइट रिफ्लेक्शन है, मटेरियल है, यू कैन रिमूव इट, दैट्स फाइन, इट्स नॉट मैनिपुलेशन. लेबलिंग ऑफ इमेज इज वेरी इंपॉर्टेंट. Virtual smile designing software. I don't know how many of you are aware about this software. This software is made by Indian orthodontist Neeraj Rohida, and this software is crazy stuff. Digital dentistry को next level पे ले गया है software, and they are selling it like a hot cake everywhere, especially in Europe and America. Madam came to my clinic, Inderjit madam. I said, give me your photograph, and in this software, I immediately put some, something on her face, and she was ready for full mouth rehabilitation. We did FMR. Same way, look at this patient. So within a minute, you can take a portrait photo and show it to your patient how they will look. Look at these images. So patient can make a decision whether they should go ahead for rehab or not. So even if you convince one patient, 10,000 रुपए आपका जो भी खर्चा है, it's वसूल. ऑल्सो ट्राई टू मेक कोलाजेस. कोलाज बना के पेशेंट को दे दो, वो अपनी पूरी फैमिली मेंबर को, फ्रेंड्स को शेयर करेगा, एंड दैट इज हाउ यू कैन एडवर्टाइज योर वर्क. सो मेकिंग कोलाज इज द बेस्ट वे. आई मेक कोलाज आफ्टर एडिटिंग कंप्लीट केस. मैं थोड़े थोड़े कोलाज पेशेंट को दे देता हूँ प्री पोस्ट, और आई कीप कोलाज लाइक दिस जस्ट टू शो पेशेंट हाउ एंडो कैन कंप्लीटली रिजॉल्व द वुंड और लीजन. So if you follow all these criteria and use mobile wisely, you can become a pro mobile photographer. I will show you few of my mobile photographs. You will be amazed to see the clarity, quality, and composition of these images. All these images are taken in the wild, in nature, outside clinic. Okay. So these are all different photos. This was my patient's eye. I took this photo in clinic using Mobi ring light. You can see these images taken in the nature. So nowadays, mobile cameras are really power packed. Another, I am telling you, 2 to 3 years, the sensor will be just at par with the SLR cameras. We don't have to worry about clarity, quality, and even zooming will be easier with attachments or detachable lenses. So these are all food photography images that we did during Corona time. Look at these images. Even nature and landscape images can be taken. Editing करोगे अच्छे से तो it will look good. So mobile is multi-purpose device, not only dental but general photography also. And one important message to everyone: reading is to the mind what exercise is to the body. Indian clinicians are very, very poor in reading. We don't read. I read a lot. I like to read a lot. क्लिनिक पे होता हूँ, पेशेंट नहीं है तो आई रीड और एडिट, दो ही काम करता हूँ. पेशेंट अगर नहीं है तो रीडिंग करो या एडिटिंग करो. दैट इज हाउ यू कैन improve your work. Before I end this session, I want to give you 5 sets for successful practice. Knowledge, skills, and experience are mandatory. So skills develop करो, documentation का knowledge gain करो. Experience photographer बनोगे तो you will able to record images. एक अच्छा setup जरूरी है for a good practice. Instruments होने चाहिए सारे. You need to use proper materials. Administration qualities, documentation, communication skills. Patient handling is another skill. How you work in mouth is different. How you handle patient on chair is different. Trained staff is compulsory. I can speak for 7 days about staff. Still, I will have a lot of material to be shared. Future trends recognize करो आगे क्या होने वाला है. जिन्होंने स्कैनर नहीं लिया, आप अभी भी हिस्टोरिकल एरा में, रॉक एरा में जी रहे हो. Buy scanners as soon as possible. Already you are late. मैंने जब 6 साल पहले स्कैनर लिया, that time I realized I am 7 to 8 years late. So imagine now how much late you are. If you decide something, quick action. Update and upgrade your knowledge, skill, experience, your setup, instrument, and materials also. And punctuality, politeness, confidence, and good health is important for a doctor to become successful. My last wise words, as we have been discussing dentistry, but please remember, dentistry is not everything in life, it's a part of the life. Enjoy thrilling and adventurous activities outside clinic. Spend quality time with family and friends, not smartphone. Travel like a wild adventure like no one. Rise in love with someone. Don't fall. Fall is a negative word. Do some crazy things. Be heroic at some moments. And your health is everything. Stay healthy. And the last line, which I have lived up to, never give up. Stay positive. Life favors the brave. I will be always in touch with you. You can always call me, share your doubts. I'm always there for you all. Okay? Yeah. Deepa?
Yeah, sir. Yeah, such a great session, and we are all overwhelmed with this. The last few words also that you shared. Thank you so much, sir. So, should we take the questions now?
Yeah, yeah, no problem.
Yeah, yeah. Dr. Ankita is there. She has asked how to take photograph with a mirror. What should be considered with plain with arch photographs?
See, when you are taking arch photographs, most of the time you are taking occlusal view. So in those, plane is not so much important. Just put a retractor, adjust mirror. Your eyes should able to see the arch in the mirror and capture it with mobile under a flash. That's it.
Correct. So, what about scratches on metal mirrors?
Scratches happens because when you keep it inside and after taking out, you rub it with a cloth. There are dust particles that causes scratches. If you want no scratches, air blow karo or always air blow and then clean it with muslin cloth or tissue paper, soft tissue paper.
True, sir. So, what about how to take pic for full arch, full upper arch? You stand in front or behind of the patient?
No, the question is if you are talking about occlusal view, then
Yes.
I always stand on the front. People stand on the back side also by making the patient completely supine. That is also good way. Depending on the available space in your clinic, you can stand on the back side or front. But again, rule is same. Reflect properly, retract properly, and put mirror. In mirror, you should able to see the arch completely.
Sir, Dr. Dwarka has asked which editing app should be used to correct rotation.
Rotation can be corrected nicely in Adobe Photoshop. I use Adobe Photoshop. In rest of the apps, there are a lot of problems. It will kill your pixels. Adobe Photoshop is a professional photograph editing software, image editing software.
Okay, sir. So, how do you use Cocolux Light for consultation?
Cocolux light is useful for selecting accurate shade. So when I am dealing with anterior implant cases in consultation, I need to select shade accurately.
Hmm.
So the polarized filter, once I select, suppose I shortlist two shades, A2, A3. So which to take, A2 or A3? So I use polarized filter. Polarized filter will block the reflection and it will match exactly. There I come to know that A2 is too much bright. I should go ahead with A3. Or A3 is dull, I need to go ahead with A2. So that decision making is easy with using mobile this Cocolux light.
Yes, sir. Which lab you are using mainly for anteriors?
For anteriors, my work strictly goes to Precision Lab, Rahul Kakodkar. They are best for all anterior cases.
True, sir.
Even yesterday, we have sent 5 veneer case. I will show you the photographs. Their work is outstanding. I will put it in the group.
True, sir. So, Cocolux Light dealer or link for purchase?
I will send it. Mr. Tarpan Amin, you can call him. Don't worry. I will share the link.
Yes, sir. Tell us about the editing as well. It was mentioned in the webinar from click to editing.
Yeah, but the problem is editing is a vast field. When I say editing means I just wanted to give you idea that editing is important and what magic you can do with editing, like cropping to up karoge, then how to you can give black background, white background. So you need to explore it. My job is to show you the path. I cannot teach you editing on this platform because editing itself needs 7 to 8 hours of constant learning.
True, sir. So, same question how to edit the photos. Should we keep the flash off when we are using external light?
Always, whenever you are using external light, flash should be off.
Yeah, sir. Editing apps, they're asking.
Adobe Photoshop is the best app because it's a professional app. It maintains the resolution of the image. Even if you save image at lower megabyte, suppose your original image is 4 MB, and after storing it's a KB image, still the details will be same.
True. Some editing tips they are saying.
I can give one demo if everyone is okay. Deepak,
Hmm.
let me
Yes.
let me just show editing. Okay, just give me one moment. I will open it in Adobe Photoshop and I will show you. Okay, that will be best.
Yes, sir.
Yeah, okay. I want everyone to pay attention. I will show you how to. Okay, I will open this image. Okay, in Adobe Photoshop. I have Adobe Photoshop Lightroom in all my computers, master computers, laptop. So hold on. Now this is how we open image. I want everyone to pay attention, guys. Suppose this is Adobe Photoshop, and trust me, Adobe Photoshop is way easier and simpler than PowerPoint. Only problem is PowerPoint is a presentation software. It's not editing software. अभी ये Adobe Photoshop है. I will not tell you each and everything because it will take a lot of time. I will just show you. Suppose इसको background देना है. तो पहले मैं इस ओरिजिनल इमेज को थोड़ा मीडियम क्रॉपिंग करूंगा लाइक दिस. देन यहाँ पे एक ऐप होता है विच इज कॉल्ड मैग्नेटिक लैसो टूल. ये मैंने सिलेक्ट किया एंड ऑटोमेटिकली इट सिलेक्ट्स द बॉर्डर बिटवीन द पार्ट. सी आप काउंट कर सकते हो घड़ी पे विद इन 60 सेकंड्स मेरा एडिटिंग हो जाएगा इस इमेज का. ओके, लुक एट दिस, ऑटोमेटिकली इट सिलेक्ट्स. इफ इट डजंट सिलेक्ट आई विल हेल्प इट. लुक एट दिस, हो गया, बॉर्डर सिलेक्ट हो गया. अब इस बॉर्डर में कौन सा कलर डालना है? ब्लैक कलर. ऑलरेडी ब्लैक सिलेक्टेड है. यू कैन सिलेक्ट एनी कलर दैट यू वांट. ब्लैक कलर सिलेक्ट है तो यहाँ से ब्रश को उठाओ, ब्रश उठा के घुमा दिया, हो गया ब्लैक बैकग्राउंड. कंट्रोल डी. ये देखो कितना टाइम लगा. एंड नाउ आई विल एडिट इट. आपके सामने इमेज एडिट हो गया. यू कैन सी एडिटेड इमेज. कैन यू सी? दीपा दिख रहा है? अब इस पे लेबल करना है तो टी को टेक्स्ट को क्लिक
Yes,
करूंगा
sir.
and I can mention like pre-operative view. इसको मैं सिलेक्ट करता हूँ, व्हाइट कलर कर देता हूँ. रेड डजंट लुक गुड. व्हाइट इज अ स्टैंडर्ड कलर दैट आई यूज. यू कैन सी प्री ऑपरेटिव व्यू. अब मुझे इस पे एक बॉक्स डालना है. आई विल गो फॉर दिस बॉक्स एंड मैंने इस पे एक बॉक्स डाल दिया. बॉक्स ऊपर आ गया, नो प्रॉब्लम. लेयर में जाके उसको ऊपर ले लो, आ गया. दिस इज माय फाइनल इमेज. नीचे मेरा नाम डालना है, फिर से टेक्स्ट सिलेक्ट किया, डॉक्टर आकाश अकिनवार. इसको आपको अगर वाटर मार्किंग करनी है तो वापस मुझे राइट साइड में गया एंड लुक एट दिस, वाटर मार्क में चला गया इमेज. कैन यू सी? हल्का सा दिख रहा है एकदम. एंड व्हेन यू सेव दिस इमेज, आई विल सेव दिस इमेज ऑन द डेस्कटॉप. सेव करते वक्त देखो जेपेग में सेव करता हूं एंड लुक एट दिस, 627 केबी का इमेज है. और छोटा करता हूं मैं, ओनली 272 केबी. 1000 केबी मीन्स 1 MB. तो इमेजिन 250 केबी का इमेज कितना क्लियर दिखता है. लुक एट दिस. यू टेल मी दीपा, इज इट क्लियर?
Yes, sir.
तो कितना केबी का इमेज है? 250 केबी. एंड ओरिजिनल इमेज कितना था? आई विल शो यू. ओरिजिनल इमेज था 337 MB, ऑलमोस्ट 4 MB का. 4 MB मीन्स 4000 केबी. 4000 केबी की इमेज को आपने सेव किया सिर्फ 250 केबी में. मीन्स आपके एक ओरिजिनल इमेज के वेट में पूरा केस आपका सेव होता है एंड स्टिल योर पिक्सल्स आर मेंटेन्ड. दिस इज द ब्यूटी ऑफ editing in software, professional software. So this I have been doing since last 14 years. I have been training this to doctors since almost 7-8 years now. There are complete one-day programs on editing. So that is why I'm telling you, if any of your friend knows editing, call him, get the Adobe Photoshop installed. Pirated version use करो, बाद में paid version लो. Pirated सस्ता मिलेगा, then buy paid version if you are okay with that. Okay, and there are many other ways of editing. Editing में ऐसा होता है कि if I teach you, you can go on exploring by yourself. The sky is the limit. मेरे कई सारे स्टूडेंट ने मुझे कुछ कुछ चीजें सिखाई जो मुझे भी नहीं पता थी. तो I have learned lot of things from my students also. And most important, अगर Adobe Photoshop सीखना है एडिटिंग के लिए तो नॉर्मली 2 hours का 3-4 महीने का कोर्स करना पड़ता है. बट एज अ डेंटिस्ट वी डोंट नीड टू लर्न एवरीथिंग, राइट? We just need to learn important things जो मैंने आपको अभी दिखाई. That means you can learn in 1 to 2 hours or maybe in a session of 5-6 hours. But live, online, it's very difficult to learn. Live सीखना पड़ेगा इसे 1 to 1. Okay?
Yes, sir. Yes.
Yeah. So we will keep this group alive. I will be there for next 3 days. After 3 to 4 days, I will exit this group. But you can always contact me for any help you need.
Okay, sir. So there are few more questions. Do you recommend macro lens for mobile camera?
No, 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 no. Those any clip-on lens, any lens which doesn't have direct contact with the camera, electronic contact with the camera are not good. They are very tricky lenses. You need hell of skills to take photos. Do not use. I don't recommend. I don't use it. Very difficult.
How to capture posterior teeth photographs?
Same way, retractor and put the mirror and you will get a clean shot. If you want to take photograph of labial side, then you need to put retractor and pull it properly. You will able to take. Maybe may not be parallel every time, but you will get a good shot.
True, sir. So give suggestion which DSLR camera to buy if we plan to upgrade. Please suggest from your experience which brand and model.
See now, if you want to buy a DSLR, you can buy a Sony, Nikon, Canon. All of them are at same level. Okay, there is no difference as such, but like I am comfortable with Sony, so I am a Sony user. Earlier I used to use Canon, then I shifted to Sony. I have never in my life used Nikon. So if you have ever handled any camera, go for Canon. Canon is good for everyone. It's easy to learn. And in Canon, Sony or Nikon, whenever you are buying, do not buy DSLR, buy mirrorless. Now it's the era of mirrorless. Like अभी बटन वाला मोबाइल नहीं चलता, सब स्मार्टफोन यूज करते हैं. बटन वाला मोबाइल ओल्ड हो गया. वैसे अभी डीएसएलआर इज ओल्ड नाउ. नोबडी यूजेस डीएसएलआर. एवरीबडी यूजेस मिररलेस. तो मिररलेस लेना है अभी, सोनी का, कैनन या निकॉन का.
Thank you, sir. Sir, contamination part. How to prevent contamination of mobile?
No, no. The thing is, if you are doing surgery, you are not going to take photos. And if you, I use disinfectant. Disinfectant से clean कर लेता हूँ and I take photos. Sometimes if it is very tricky for my assistant to take photos, I use disinfectant. Disinfectant लगा के clean करता हूँ. Do not put mobile in autoclave or anywhere. Just clean it with disinfectant. Okay.
Sure. Sir, you said not to crop image. Plus, we discussed not to zoom and take it in 1x.
No, no,
Then
no.
how to?
You can crop image. Do not zoom image. Take the image and crop it. 10 pixels are so much that even if you crop it, you will get good details, but do not crop too much. That is why while taking images, take images in such a way that you will have to crop it minimum. हम लोग क्रॉप करते हैं लेकिन मिनिमम क्रॉप करते हैं. जैसे मैंने ये वाला इमेज दिखाया, इसमें मैंने क्रॉपिंग कितना किया देखो, फुल इमेज देखो मेरा. मैं बैक जाता हूँ. दिस वाज ओरिजिनल इमेज. इसमें से थोड़ा पोर्शन क्रॉप किया, बट ओवरऑल इमेज इज लाइक दिस. तो मेरे पास पिक्सल्स बहुत है. दैट इज व्हाई इवन आफ्टर क्रॉपिंग आई कुड रिटेन द डिटेल्स. यू कैन सी द डिटेल्स हियर. ओके, सो क्रॉपिंग करना है बट मिनिमम क्रॉपिंग करना है. दैट इज व्हाई फोटो ही ऐसा लो कि आपको क्रॉपिंग कम करना पड़े, बिकॉज जितना क्रॉपिंग करोगे उतने पिक्सल जाएंगे. दैट्स वेरी ट्रू.
So, do we have to take any subscription for Adobe Photoshop or PowerPoint?
Yeah, you can take a monthly subscription. I have taken a monthly subscription of Adobe Photoshop on desktop. I use on desktop or laptop. I never use editing softwares on mobile. Professional proper work करना है तो desktop या laptop लेके बैठ. With mouse. Mouse is compulsory for editing. Without mouse, with hands, you cannot do editing. Golden rule.
True, sir. So, yeah, list of phones with good camera you will put in the WhatsApp group,
I
right?
will put soon. Give me some time.
How to clean the mirrors after use? Sir has already told in the webinar.
Yeah.
If we go away for depth of field, extraoral,
Ah.
and other clutter also comes along with it, what we should do?
No, extraoral में you need to put proper background cloth. Black और white background के curtains आते हैं रेडीमेड. जैसे आपके vanishing blinds आते हैं ना सेम कलर के. Intact vanishing blind जैसे blinds आते हैं, you can pull it down. So background black या white ही रहेगा and you can be 2 to 3 feet away. So you will get good photos.
So list of mirrors also to be bought quadrant and full arch.
Yeah,
Does
yeah.
lens protectors distort image quality?
Lens protector.
Distort image
Not
quality?
necessary. If it is clean, it is fine. It won't distort.
Yeah, good retractors. Any
Oro
other way
or
to?
Oro or Hager company retractors are good.
Hmm.
You can buy that. Okay. I'm putting a list of mirrors also. Okay. This kind of mirrors are good. I have already put up in the group. You can buy these mirrors from Kush Mahajan.
Hmm.
Okay. These are good mirrors.
Any
Yeah.
other way to practice dental photography other than doing it on patients if we want to improve our photography skills?
Yeah, you can take different models and you can use your assistants. You can practice on your assistants if not patient, and you can try to take different creative shots outside of different specimens, mandible, maxilla models. That is how you can practice.
True, sir. Use of disinfectant in gloves or mobile.
Yeah, I told you, you can use any
Yeah.
disinfectant. Okay, alcohol based disinfectants.
Yeah, sir. Again, doctor has asked, is Apple iPhone not good for
Not
dental
good,
photography?
not good. I don't want to disappoint you, but I have tried and tested most of the Apple phones. They were really bad for dental photography.
Yeah, they can use it without their flash and with Mobi Ring, they can use it. Yes.
Yeah, yeah.
So, how is DG Scope by Unique?
Digiscope is good for, my wife has it. It gives you immediate picture of, intraoral endo cases and all. We have that Digiscope. You can use it. She is using it. You can connect it on your mobile through app and you can see on the screen. Not great, but it's okay. You can use it. Nowadays, there are digital loops. Through loops only you can see and you can show it to patient. But those loops are very costly, 2-3 lakhs and more. So this Digiscope is quite cheaper. You can use it.
Again, sir, how to disinfect or sterilize the mirror?
Yeah, I told you, you have to first wash under tap water, clean it with disinfectant. You can use disinfectants only. You are not supposed to use it in autoclave. You will spoil it.
So, doctor is asking 1 to 13 hour.
I
Any
have
opinion about?
tested. I have given you the criteria. You yourself check it. How to? I will post the
Correct.
photo also so that you will understand. Okay, give me one moment. Yeah, till that time you can ask another question. I will post it. Don't worry.
Yes, sir. Same question as 25 Ultra. Sir, Mark Loops Digital 3.5 lakh start.
Yeah, yeah. But that is great. That is great. I have tested recently. Although for surgical work, it's not good because surgical field both bada hota hai. But for restoration, endo, perio, I think it is beautiful. I like it. I have asked them to give me 2x because for surgery, I think 2x will be good. Hold on, hold on. I am just posting one slide that will help everyone to select their mobile. Hold on. Yeah. Deepa, I have just posted a photo. It will help everyone.
Okay, sir. So I haven't received it yet. Maybe some. Yeah, yeah, yes, sir.
And I am also sending photograph of the mobile that they should buy. Samsung Note 10 Plus. It's an old phone. You will get it at 15,000 or less. Buy it whenever you find it.
Okay, sir. Thank
Any
you.
any any alcohol based disinfectant. Okay. Huh.
What's the name of the Instant Smile Makeover app
Yeah,
by
it's
Dr. Lukman?
एक मिनट it is. It's a DTS software, digital treatment simulation. Let me see if I have image. I will show you the demo. I don't have DTS here, otherwise I would have given you demo. But it's very easy. Anybody can use it. It's self-explanatory. It's a beautiful software, DTS software. You can use it. That Neeraj Roida will give you a good demonstration. You call him if you want to buy DTS software.
Yeah, thank you so much, sir. I think one or two doctors are typing more questions. Otherwise, we are done with this. Thank you so much.
DTS software, I am giving you number. Don't worry, you can put your questions tomorrow, day after. I will answer when and whenever I am free. Don't worry. Neeraj Rohida, you can call him. And whenever you call Neeraj Rohida, give reference of our MDP workshop. He will give you good discount.
Yes, DTS is paid, Dr. Nida. Yeah.
I am sending you Jaldent number. Okay. You can call Jaldent. Okay. You can call them at their office and they will send you. Okay.
Yes, sir. So it was really a wonderful, power-packed session today
Thank
for
you.
mobile dental photography. Everyone, whoever in whichever field they are practicing in dentistry, they can use this and document their cases. And we will be great that they'll be sharing these cases if they share these cases in WhatsApp group. And also, you have one group for mobile dental photography where they can participate and yeah, put their cases.
On Facebook.
Yeah, thank you so much, everyone. You'll get the link to view the recording by tomorrow evening. So just be patient till then, and the recording link will be accessible for 15 days. Okay, thank you so much, everyone, for being patient till such a late time and being with us. Thank you so much.